It'll fall apart immediately, I'm sure. But as of now, I think we're all right. We are recording this one as well. And again, it's just audio, not visual at all. So let me navigate around to find where I was.
And we are, as always, Jordan, Christine, and Rebecca. And we're glad you came back.
All right. Everything works. Okay, I suspect that we'll have more free time today than we did last time. We're going to go over two very important things at the very beginning, and these are the applications for extra help and for the Medicare savings programs. After that, we'll go over the Medigap comparison that we'll do through the SHIP TA Center, if you want to queue that up down the road. Then we have a cost tip sheet that we get from the state partners. So all of these numbers that we talk about all the time, don't feel like you've got to memorize them. We've got them all on one handy sheet, so we'll be able to look at them. Then, of course, questions and break. Volunteer introduction. I'm afraid we don't have any volunteers that are able to come today. We, as part of this new style, like to have the mentor volunteers come, but I didn't get the word out in time. That's on me, and they weren't able to come. Then we'll do some scenarios where we're going to put you on the spot and do Melissa's favorite thing, which is role-playing Medicare scenarios. And then we have all the time in the world. We really do have all the time in the world to go over anything that we've talked about in any of these training days before we take the test. The test, it's very scary. Let me tell you how scary it is. It's open resource. It's multiple choice. You can ask the questions to each other. You can Google every question that you want. Preferably you're searching on Medicare.gov or through the Medicare.
Search reliable websites.
Pretty much the only thing that can happen is we can't give you the answers. But if you happen to fail the first time, you get to take it again, second time. So it's
We've
really
never had anybody fail who's been through the course.
No, it's very low
Have the
pressure.
PowerPoint with all the answers.
Yeah.
Yes. We will pass out PowerPoints from first, second, and third day. So everyone should have all the answers on hand anyways. Okay. Want to start off first, I think, by talking about the videos everyone watched and the call shadowing. What were your experiences there? How'd you guys like it? Yeah?
It's good.
Yep.
Tell us about Lebanon too.
Oh, yes, the events.
It was at a senior care facility and it was packed. It was also lunch and bingo day.
Great.
And so there were over 150 people signed up.
Was it a senior care facility or a senior center?
Senior center, I'm sorry. And they had us in a little room off to the side with a sign that I didn't even see until I was on my way out. And it was maybe waist high to me. So it might not have been, because the room was just tables. And so it might not have really been high enough for people to notice it. But the transportation, people were in there and WeGo was there also, transportation. And they were doing surveys and things like that as well. And I was with Meg. Not a lot of people came through. Maybe 15, 20 total. And not everyone came past us. Most of them got stopped on the other side talking to transportation.
If they see the table, you can count them as having seen the table. That's what counts for events. That's why we always say hi.
But the ones I logged, people we actually talked to, they all had some form of Medicare or TRICARE. They all had something and weren't really interested in learning more, but they stopped to chat, you know.
What did you think?
It was fun.
Sounds a little atypical. I mean, usually we get a little bit more engagement.
Yeah, and I think it might have just been because we were putting a room in the back and
Yeah.
the signage wasn't prominent or,
Yeah.
very visible.
Yeah.
Yeah, everybody was really nice and they were excited we were there.
That's good.
What about your shadowing with Tom?
Tom's great, extremely knowledgeable.
Mhm.
We had, one call, no one else answered. He left messages. We had one call, it was probably like 20 minutes, I think. Um, he just had a lot of questions and he was very thorough in answering what they were. It was just amazing, the depth of his knowledge and just how he talked the person through and they'd get stuck on a point. He would try to lead them back to be relevant, just his technique. After 4 years, you really figure it out.
Yeah.
Yeah.
Yeah, Tom, and then we also have Ray and Nancy have all been doing this a very long time. And those are the three biggest names that are on the call log when calls come in and people assign it to themselves. So very fortunate to have Tom. Very fortunate for him, especially because he really loves mentoring. He's jumped in every single chance that it's been
Yeah.
offered.
Mhm.
So
All three of them are happy to mentor people.
Mhm.
Tom is a particularly good mentor.
it's true. What about the videos on the TA Center? Did everyone have a chance to watch those? No?
I did not. I had a ton of stuff at work.
Ah,
We had a cookout right after my all-day thing, shadowing, and it's been super busy at work.
cookout good at least.
Oh, yeah, we had, well, it rained, so most of the people came down and, yeah.
Good.
So much food, so many people.
That is part of the training, so we do want you to get it done by the end of the month.
How was the Murfreesboro? You went to the senior
And
center?
yeah, and that's, part of what I've been trying to do my training at work
Uh-huh.
because I can't do it at home.
Yeah.
But yeah, there were a ton of people. So the senior center was completely packed. We did have one guy come by to tell us that, the meal would be served at 11:30, so we needed to wrap it up by 11. So we should start packing up at 10:45 and no later. Like, thank you so much. Gotta love 80-year-olds, they're great.
Oh, wow.
But
Okay.
I bet we had 100 people that, just came through and talked
Really?
and
That's
it's
excellent.
funny because, I work next door and my residents would come over and they're looking, it's like, what are you doing here? Yeah, just learning. It was nice,
And did you have a lot of people stop and ask you and Susan questions?
a whole bunch,
A whole bunch?
whole bunch.
That's good.
So was Susan able to help them out, give them the info they
Oh, yeah,
needed?
and we gave out tons of brochures. They had a lot of caregivers that came through too, that were gonna take brochures and, we stayed busy. It was extremely busy for this few hours.
Good. I think that's a more typical experience than not having very many people come by. Most of the times if we're out and, we say, hey, we know about Medicare, people are busting down the door to ask us questions, or at least to tell us about their situation.
Depends on the event. Sometimes there'll be rival attractions, as it sounds like there were in that case.
It was very full. There were a lot of people.
Well, I did a long shadow here with Christine.
Yeah.
It was interesting, very interesting. I guess we got some unusual calls. I don't know if you remember, you said that was unusual.
Oh, yeah. No, we had one call and it was just very weird call. That's very strange. So. Gil-
But, I mean, very knowledgeable. She just rattled off things. I thought, man, she's just so smart.
Well,
She
again,
knows all these things. I know she has.
it's just experience. I mean, this is years of experience.
Yeah, but I just loved how she was able to help this individual, like, figure some things out and then direct her, to the rightful resources that she needed. And so that was,
Yeah. I kept telling Melissa, okay, well, this isn't exactly optimum. On the other hand, it's a good example of what we should do. It's like, I have no idea, so I have to make sure that they go to the source. And absolutely. That is something that I say again and again. Don't try to pretend that you know something that you don't. It's much more important for the people that we help that we give them good information. We
Right.
don't have to, we don't have to have all the answers. We just need to be able to tell them that we will either get the answers or where to go to for the answers.
But you helped her make sense of that too. I think that, on that one call that, she just kind of, like pieced it, and helped her
Yeah.
figure out where she needed to go.
Yeah, one of the biggest things that you will be finding if you do counseling is that this is really foreign territory for people. And there will be things that they just don't understand that are fairly basic concepts like the Medicare versus Medicaid, because they haven't experienced it. They don't know what it is. And they won't understand like Part A and Part B. They'll not understand the difference between a Medigap and a Medicare Advantage plan. And that's one of the biggest things that you will find yourself doing. And one of the ways that you can be most useful is just letting them know what they already have. Lots of times we're not even getting them anything new. They just have no idea what they actually have. Well, thank you all. This is really good. All of you have taken the time in between our sessions to get an idea of what it's like. And I hope have enjoyed it somewhat. Yeah.
Yeah.
I mean, but if you haven't, I mean, that's fine too. Then you know what you don't want to do.
And that is a good point. This is, of course, volunteering. So if there's anything that you don't want to do, don't feel any pressure to do it. If you prefer counseling and don't want to do so many events, that's okay. If you like events and don't want to do a lot of phone counseling, that's okay too. So whatever you'd like, really. What do you say we show off the low income subsidy application?
Let's do it.
All right. I think I've pulled it up. I tried to make it a little larger.
Okay. Thank you. Thank you. Okay, so one of the things that we can do fairly quickly and easily for people, and that can make a huge difference, is to have the low income subsidy application and help them fill that out. We can fill it out for them online, submit it. It's all pretty quick. You get used to it. It's like 10 to 15 minutes to fill out. You can access it through the resources on the volunteer page. Or if you'll note up here, there's this, you could just bookmark this if you want. You can do whatever is easy for you. You can search extra help, Social Security extra help, which I sometimes wind up doing. But it's extra help with Medicare prescription drug plan costs. And we also call this LIS, just because it's a little quicker to say that. And that stands for low income subsidy. And what it is the program that helps pay for people's drugs. And it can help pay for their premium. In some cases, it will pay for the premium entirely. It can help pay the copays, and it gets rid of the coverage gap. So people who are dealing with this don't have a coverage gap. Basically, next year, nobody will have a coverage gap. But for now, this helps get rid of the coverage gap. So there's just a lot of help here. Monthly premium, annual deductibles. So if you are on this, you're not going to have a deductible, and your copay will be lower. The nice thing, they haven't changed the wording of this since it became full extra help for everybody. But if you're entitled to it, you now get help with all of these things because everybody now gets the full benefit of this program. It used to be you would get help with only some things if you made a little bit more money. So this is where the cost tip sheet comes in too, but you can see here it has the assets listed, and your income is going to depend on, it's going to 150% of the federal poverty level. That changes each year, and that will be on your cost tip sheets as well. So you basically, when you're talking to somebody, you find out whether they seem to meet the assets and income guidelines. If they do, you just go ahead and click apply now. And you don't really usually have to worry about going through all of these things. Most people know what their social security number is. They have a vague idea of what's in their bank account. They usually know how much they make. So you just basically tell them, I'm going to be asking you some questions about your income. We're going to need your social security number. We're going to need to know how much is in your bank account. Then there, for some reason, like one of the longest part of it here is this whole thing at the beginning, which is just about who's doing it. Are you assisting someone? And yes, you are assisting somebody. This is very different than a lot of the situations where we are in, because we are actually assisting somebody and writing down that we are assisting somebody. Most of the time, we're acting on someone's behalf and we're not their assisting person. But here, they do expect us to give all this info about being someone's assisting person, which means that you need to provide a phone number and an address and all of that. And please go ahead and use the GNRC phone number and address. You don't have to use your own. So do you or your spouse, if married and living together, have Medicare? Maybe let's say they don't. 64, let's say they are. So this would be somebody who is about to start on Medicare, 64 years and 9 months or older, or somebody who is about to start on Medicare because of Social Security disability or Lou Gehrig's disease or renal dialysis, kidney transplant, the ESRD provision. So we'll say no on this one. And this one is always going to be Tennessee. If the answer isn't Tennessee, then you direct them to shiphelp.org, or you look it up for them and you tell them which ship that they need to be talking to. Marital status, married, living together. You have combined savings, investments, assets. And here, it's basically they're asking whether they qualify again. So if they qualify, you actually click no. On to the next page. Are you assisting someone? Yes, yes. So they're not gonna like my, let's see, you must choose no or yes. Oh, I didn't choose no. They didn't get an application. Very rarely will you ever be helping somebody who's gotten an application in the mail. If they've gotten an application in the mail, they're usually gonna do it themselves. Again, they're just asking, do you have the information here? Okay, so again, for some reason, they ask all of these questions about who is helping.
That's because it's extremely important in a nursing home.
Well, no, I mean, no. I mean, so what I'm saying is that Social Security never, ever comes back to us and asks us to do anything. They never, ever do. And in any other situation where people actually do need to know it, they do need to come back to it, we are not the assisting person. So it's only on this particular format that we are the assisting person. So I've always assumed that it's a government thing where they are simply concerned that nobody commit fraud, because we never have anything. Now with TennCare, you have to be extremely careful not to list yourself as the assisting person. So I'm just So here you could do 615-862-4345. And here you would put SHIP counselor. Okay. Doing with the caps. And this is 44 Vantage Way. Can't tag this morning, my apologies.
I find that keyboard to be small.
Yeah, it's just the wrong size somehow. Thank you for the excuse. So if you'll note, these are all things that you can use. Let me change this to 4345. So 4345 is our first available counselor number. And that's a number that you can use anytime you don't want to give your own number. It means it will come through us. If you are doing phone counseling, you probably are going to need a number where they can reach you. So we can talk about that if you're concerned about giving out your own number and we need to figure out something else out. But in general, people do give out their own number. But say you are phone counseling and you know that next week you're not going to be available, then you would probably say, look, next week I'm not going to be available. Here's 615-862-4345, and that'll get you a counselor and they can help you out if you have any more questions. And then, of course, we are right here, 44 Vantage Way, Nashville, Tennessee, 37228. Again, this, I mean, I fill it out because they want me to, but I have never, ever had anybody come back on this one. As you were pointing out, it's very different if we're talking about TennCare or something where somebody at the nursing home might actually need to talk to somebody. And that's why we never put ourselves down as assisting person in that situation. So then basic stuff here, name of the person who is applying. And then this is where you need to have their social security number. And their date of birth. Sometimes you may have somebody who is hesitant to give you their personal information. That is absolutely fine. Never, ever make them feel like that's not okay to be cautious. People get into far more trouble through not being cautious. So there are a couple of ways of reassuring them. I mean, remind them that they called you. You did not call them, in a nice way, you know, say, oh, well, remember that I'm responding to the call that you left on the main hotline. Give them the number for GNRC. And let's see, I'm trying to think which would be the best. I guess the front desk number, which I don't have memorized, but I look it up if I need it. Also, you know, if you're working on this and they're uncomfortable about it, you can always say that they personally can fill it out online if they have that access, or they could do it with a friend or a relative. It's entirely up to them if they want to do it with somebody else. But do just try to reassure them and continue onwards. Most of the time, they will, after talking with you, be reassured, but never push them. I mean, pushing is what scammers do. We don't care whether they do it or not with us. We just want them to get the help they need and just convey that, and they're usually fine. Most of the time, the people we're talking to haven't worked. If they did work during that time, they're just going to want to know when they worked. Not sure I'm going to be able to see because that screen won't show up until Social Security and the Social Security number's wrong. And you can also apply for the spouse if you've got a married couple. And just check on the assets. This is probably one of the trickier questions. So if they don't already have the Medicare savings program, We have been advised that the best thing to do is to go ahead and apply with them. Usually you would want to set up a separate contact for the next day because it's a long one. That application takes a while. So I frankly still am not quite sure if I'm doing that. Um, I might say, no, do not send the information to the state, even though they are qualified for it, because I don't want that to mess up the application that I'm doing. Other situations would be where somebody actually doesn't want that program. But if you're not doing an application for them because you think they probably don't qualify and they have nothing against having that program, then I probably would leave it unchecked because who knows, maybe something would come up, TennCare. They might find something and they might actually be eligible. So, so this is an opt-out situation. And then I can't really do anything else because I don't have a real social security number. So this is where I'm going to end it.
Let me get you to the confirmation.
Oh, cool. So after you've submitted it, then you get to the confirmation page. And this is what you need to save. You are going to want to attach this to your data entry, your contact in stars. So this application right here, you would save and then you would attach it in stars and then you would delete it off your computer. But if you've done an enrollment, you're going to be putting in stars that you did do an enrollment. The main thing that you want to make sure that the person you're speaking with has is if you go back to the first page here, okay, then you can see this is the confirmation. The confirmation, instead of being a number, is the date and then the time down to the second. So notice it's 46 seconds. And so this is something that you want to provide to the person you're talking to. You can email it to them with secure in the subject line. And you can just also have it mailed out by admin. Admin can send out a copy of the confirmation if they want that. And let them know that they should be hearing from Social Security in about 30 to 45 days. Any questions about any of that? Oh, look at Sesame Street. Does all of that make sense? Okay, and this is tremendously helpful. This is one of the main reasons why we exist. Jordan will be tackling the other one, I think.
That is correct. Thank you. So that's the low income subsidy, which I don't know, I, for whatever reason, think LIS in my head more, but it's much more colloquially known as extra help. That's what it's advertised as. That's what everyone knows it as. I think I should get into the better habit of calling it extra help to beneficiaries.
I don't know. I'm sort of torn on that because the problem is extra help makes it sound like it is something that it's not. So sometimes when I'm talking to people and they're like, I'm talking about extra help, they think that somebody's going to hand them money. And of course, I know,
Really?
yeah.
Oh.
And they also think that it has to do with, with Medicare. So I don't know. I haven't, all these years, I'm still undecided. I usually call it the low income subsidy, also known as extra help.
Well, give it its full name. That's administered by Social Security, of course, but we also do the screenings and applications for the Medicare Savings Program, which is administered by the Division of TennCare. Hopefully, when someone reaches out to us saying that they would like assistance applying, they have an email address. If that's the case, we can go to the TennCare Connect website, which you can find by going to Ship Volunteer Resources, which is the best page on the internet, scrolling on down and choosing TennCare Connect. That'll take you to this landing page. Here, you'll sign in, and the tricky thing is that unless they've had TennCare services before, they'll need to create an account. So you'll come in here and you'll, in all steps, ask them what they would prefer for their username. But we get a number of people that say, I don't care, or just make one up, or do whatever the heck you want. If that's the case, I put in their email addresses here. Well, they're one address in both of these fields. That's the plural. And then everything before the @ sign, I'll just copy and paste as the username and let them know that that's what I'm doing and encourage them to take notes. Then, of course, fill out first name, last name, and the passwords. It'll ask all of these security questions, and we get, a pretty substantial amount. I don't think that they're the same for all three, so they have a lot of choices. They're spoiled, really, for security. And you'll walk them through finding their answers, and again, encourage them to write the answers down. You'll be surprised how often these answers change these questions. Favorite book, a year down the road, they've read something else that's changed their life for the better, and that's their new favorite book. And who can remember the favorite book before that? I won't go through that whole thing, but I'll let you know, after you go through this process, it's going to send them an email. That email is going to have them verify that they are attempting to create an account. And in that case, they need to be able to access their email and click the button that says, yes, I am actually trying to make this account. Once they've done that, then it's very easy to go back to the sign-in page. And then you've got their username, you've got their email, you've got their password. You're not a robot, I hope. Pretty quick, you can log in. Now, that's what we can do if they don't have if they do have an email address. If they don't have an email address, a couple things that you can do. First, you can send them on to Christine and I. So because we are staff, TennCare allows us to have special permissions with their portal. We got to sit through the most exhilarating 4-hour training you can ever imagine.
3 times
Have you really?
on their
On the
form.
partner support?
Yeah.
Oh, wow. Yeah,
Not partner support, but their application that they had built out a few years ago.
really. Yeah, and was it as fun as I'm making it out to be?
Oh, yes.
Yeah. Uh,
Probably the same form, just maybe a little different.
Probably. We'll scroll through it here in a bit. But that allows us to go through and do applications without using email addresses. Another thing that you could do is download the fillable PDF of the application, fill it out, and then mail it off to the person to sign, and then they would mail it in to TennCare. Now, this doesn't allow us to go in and show off the application nearly so prettily as the low income subsidy does. So we're going to go through a pre-submitted application, doctor it up, hopefully to remove all of the actually identifying information. I'll let you know before you do one of these applications. So Lisa, don't worry. We'll show you how to get it done before we'll. Oh, no, it's okay.
Okay.
I'm making jokes.
Oh,
Because you've done this 1,000 times, I'm sure.
yeah, and it's terrible because the way that you're doing the email addresses,
Uh-huh.
if it's not it, TennCare doesn't knock it out. You have to try it and try it.
Really?
Uh-huh.
Oh, wow. I've never tried to log in without already knowing that everything was correct. So do you have to go through and reset the username and password?
Well, the username, if they already have somebody like that,
Uh-huh.
it won't tell you until you've tried to submit. So then you
Oh,
have to
I
go
see.
back
Wow.
and try again.
It's annoying.
And I'm really good at setting up email addresses now too. It's terrible.
You make like a really quick Gmail?
Yeah.
Yeah. We've got some volunteers that will do that. And that's something that you can do if you'd like, is help someone set up a Gmail account if they don't have one, but
Do they have to have a working email address?
They do.
they do.
We can do it, you can do a fill-in. You can do an application where you can fill it in online, in which case then you have to send it to them for their signature. You have to print it out.
You
send it.
couldn't just like their name at example.com,
No.
but
No.
like send it, but
No.
will not.
No, they have to get the email and verify that it actually is their email in order before they're allowed to set up an account.
And at my building, I forgot my phone. I'll be back.
Mm.
I'm gonna go to my apartment and get it.
Mm. So when you're actually doing the application, it's going to look very different. What we're going to go through is this summary that generates when we do an application through the portal. When we're saving documentation to upload it into STARS, the important thing to know is that this first page is the only thing that we'll upload to STARS, because the subsequent pages will have social security numbers and full names and addresses, date of births for sometimes multiple people. And that's information that we don't want in STARS, because that's all the information that someone could use to steal identities very well. So this first page is going to have an application tracking number. When I do these applications, I prefer to either email or mail this first page to the beneficiary. But if they don't want either of that, which has come up a couple of times, I do hope that they'll let me read off this tracking number to them. Because if they have a problem with this application, they can call TennCare Connect. And TennCare Connect can use their information to look them up, but having this tracking number is a lot more efficient for them. A lot less guesswork. And I've not had to call and ask about these tracking numbers because I'm spoiled and have the partner portal, so I can just look in and see the application status. But from the beneficiaries I've spoken to, the tracking number is quicker than giving date of birth, social, zip code, first name, last name, and reporting if they've ever been known by any other name. So you'll scroll through, and the first few questions that they ask are the general demographic questions. So name, age, languages, addresses, phone numbers. And here is something that you will see if you're helping someone do one of these applications online. This assisting person is very different than the assisting person on the low income subsidy, like Christine was saying earlier. For the low income subsidy, which is through Social Security, that assisting person is just the person filling out the form. Like you said, we've never had Social Security come knock on our door asking what we're doing. However, TennCare puts weight behind assisting person. The assisting person on a Medicare Savings Program application is someone that TennCare will speak to on the person's behalf. Depending on the level of power the application gives the assisting person, you can make selections. Someone might be able to receive copies of all of the communication that TennCare sends out, so their own copy of all the paper mailing. They might be able to renew on behalf of the person, so submit documentation that maintains their eligibility, proves that they've maintained eligibility, I should say. They might be able to call and talk to TennCare and even sign forms on behalf of the beneficiary. So an assisting person on this application, we don't ever want to be, because that's going to be a level of personal power that we don't have with the, or personal privilege, I suppose, that we don't have with the beneficiary. So it'll ask, I don't think you'll see this one because this is my partner portal. But if the person wants to list an assisting person, most people will say no, but some people, particularly those whose first language is not English, will say yes. And then it will ask about the information for that person. So their phone number, name, address, things like that. Then it'll ask about the people in their home. And when you do the application, it's pretty good about saying who is considered another person in the household. The home doesn't necessarily mean the building that they live in. It doesn't mean the house, especially if they're sharing the house with other family members. For most people, especially say if a retired parent is living with their kids, but their kids aren't providing more than half their financial support, or if the kids aren't claiming the parent as a dependent, then the parent is just in a household of one, and they're considered to be a single household, even though right down the hall they've got maybe 3 or 4 other people. And the rules on that are on the application. So it'll ask if you're applying for coverage. Yes, of course. Aliases, no, not for, I think we chose Abe Lincoln. Gender is present here. It'll be male, female, or prefer not to answer. For a number of the demographic questions, they can say prefer not to answer. Date of birth, social security number, you just ask the person, put it in. Here's something that's tricky. It'll ask if they're a US citizen or a national. That's going to be yes for everyone because only, citizens or nationals are allowed to apply for the Medicare Savings Program. The next question is naturalized or derived US citizen. That has a little tagline under that says, this means that you were born outside of the United States. So if this is an immigrant or a refugee or some other person that was born outside of the United States, they may be a naturalized or derived citizen. So we'd answer yes to that. And then these alien numbers, the naturalization certificate number, I've never seen that those have been required. So we
Yeah, they've
skip
never been
through
required.
that.
Don't worry about it. I mean, they may, so on some of these things, they may come back and ask them for more information. So, and that may be one where they do. So I say don't worry about it, but I actually do ask if they have it handy. Because if they do have it handy, then put it in there.
Yeah.
But if they don't worry about it.
Living arrangement, you get the option of at home, temporarily living out of state, homeless shelter, assisted nursing facility, maybe a few others. I forget. I've only ever had people live at home. And it wants to confirm that they're a Tennessee resident because for this, which is offered through the Division of TennCare, they must be a Tennessee resident. More demographic info. Kind of scroll through. Let me double check. I'm not skipping past it. Okay. It'll ask tax filer details. It wants to make sure that the person's not being claimed as a dependent. And then it'll ask all the standard income information. And you just put in what the person reports to you. It will ask if other people help pay for their food each month or for the rent. This comes up every once in a while. Just answer honestly, so have the person tell you what is actually happening. Now, this is meant to ask if another person is giving them assistance. So if they get food stamps, then we wouldn't count that. We can say no and scroll on. That happens pretty frequently. Scroll this. These are all different questions about their income. This is an important page. Once you enter in their income information and maybe resources as well, it goes to additional questions. And this top page for our program this top question for our program is the reason that we're doing this application. Does anyone have Medicare or want to get help or keep help paying their Medicare costs like premiums and copays? You might know this as QMB or SLMB. We know those collectively as Medicare savings programs. We want to say, yes, absolutely, they are looking to have that. And then it'll have us choose which members of the household are wanting to apply for that. So we just choose. The other questions don't matter too much unless they have had SSI. That gives them some automatic benefits. So if they've had SSI in the past, you can say yes. The other things are more for Medicaid, and I guess I haven't said this yet, but it's important. TennCare has a single application for every single service that they have. So this one paper that we're going through applies for every TennCare service. That means Medicare savings programs. That means Medicaid health insurance, so the state level health insurance. That means the Choices program for people that need a nursing home level of care, and a few other things. So these subsequent questions, many times, don't really have anything to do with the Medicare savings program. And if they don't seem applicable, you could scoot over, like, is anyone in the household under the age of 18? Well, if you know that they've got a household of one and it's just them, then we can scoot past that. Of course, they wouldn't be applying for Katie Beckett. I do want to point out this question. Is anyone living in a nursing home now or needs this kind of care but does not live in a nursing home? This is typically going to be no for us. And the reason is if we say yes, then TennCare is going to think that they need to fill out, they, the beneficiary, needs to fill out a particular form called a pre-admission evaluation. Lisa, you're smiling. You've heard of that, I assume. Uh,
It's always gonna, let me put it this way, it's always gonna be no for us.
Yeah.
If they say, wait a second, I do need nursing home level of care, then we would shift it over to 615-255-1010.
Yeah.
That's not us.
Yeah.
And if they do that application, then they would automatically also be looked at for the Medicare Savings Program. So we would pass the buck for sure. So we always want to say no, because you don't want them getting messed up with trying to prove that they need to go into a nursing home because, or that they need that kind of care when they don't.
Yep.
It's a real mess.
So we would say no, but still refer them.
No, you'd say no.
right.
You'd say no. If it turned out they actually needed it, you would stop the application and you would send them to, you would, because that's an urgent one. This one, the Medicare Savings Program, they take their time. With the PAE, where somebody is actually needing nursing home level of care, those should go through faster. I can't guarantee that they do.
But they ought to.
They ought to. I mean, they've got a lot bigger problems than who's paying for their Part B premium if they're needing nursing home level of care.
So that'll be no for us. Because if we say yes, it really gums up the works. We should be sending them to our information and assistance line. Some of them do the screenings for choices programs. And then refer to our social workers to go out and do the evaluations for the PAE, unless unless one of the beneficiaries that's calling in already has Medicaid service, or technically has an MCO, in which case we'd be very surprised that they don't already have a Medicare savings program, and I think we'd still refer them to INA to double check that they do have an MCO and refer them to the MCO for that. But yeah, big takeaway there is that for Medicare Savings Program only, it's going to say no. We'll scoot on down. There are a lot of additional questions. We can scoot through those pretty quick. It does ask if they have any expenses, and we say yes to that. And then if they have any financial accounts, and we typically say yes to that as well. It'll ask us about their expenses, and it'll go through and break down all the types of expenses that somebody has. And so it'll look at the money that is leaving their accounts. And they'll actually have to prove this. When we send in the application, then TennCare is going to send a list of additional documentation that the person needs to send in to prove their eligibility. Usually that's 3 months worth of bank statements and sometimes some other things. If they've got a vehicle, they'll probably want to see the tags and registration for that. If they have a home, sometimes they want to see a lease or a mortgage payment on that. And then resources, that's where we get to the thing that I was just talking about. I kind of jumped ahead of myself there, didn't I? It's Monday morning, excuse me. It will ask who they bank with, and it will require us to answer that. Or it did when I did one last week. Here in January, it said not answered. Or maybe I
Is it
doctored
different for
that?
the portal than it is for the online application? So
Actually, I think you're right, because the one that I'm thinking was one that another volunteer had done.
yeah.
Yeah, you're correct.
So we sometimes run into things when we're trying to explain it because as Jordan points out, we're spoiled. But it's slightly different online
Yeah.
applications than the portal applications.
So on this one, because I did it through the portal, it allowed me to scoot over it, I suppose. If you're helping someone do it in their own account, it's going to require that you enter in the bank name. It's important that we get the bank name correct, because then when TennCare goes through and does their check to make sure that they are eligible, if the bank name was incorrect, then the beneficiary has to prove that they don't have an account at that bank. And that means going to the bank and asking them to write a letter that says this person doesn't have an account here. And I've heard that that can be a difficult process for some banks. I think proving a negative in general is a difficult process.
Yeah.
Yeah. And here's information on vehicles. If they have just the one car, I entered stuff here. If they have just the one car, that's not looked at as a resource for the MSP. So you wouldn't even have to worry about how much the vehicle is worth. You could just put in a guess there and move on. And property information. Now, life insurance details, that's an important thing because life insurance might or might not be considered a financial resource. If it's a type of life insurance that can be cashed out and the person get a lump sum back, then it is considered a resource and might put them over the limits for an MSP. But if it's something that they've paid into and they cannot reclaim any of the face value, then it's not considered a resource, from what I understand.
Yeah, it's the ones that are considered resources are called whole life. And the ones that are not considered resources are term. So you can ask them about that. They do have an insurance policy. It's possible that they're going to be required to send a copy of it, whether it's whole life or term, just so that they can prove what it is. But you're basically asking about the face value of it. Like if they were returning it, if they decided to cash it in, how much would they get?
Okay.
Unfortunately, I've never met anybody who knows that answer.
Yeah, I get maybe about this much, or no, maybe it's this much, a lot. And then we just kind of have to ask them to commit to a number so that we can move on with the application. And then TennCare is going to double check anyways. So once they have the paper, they'll know for certain. Do let the beneficiary know to start looking for that paper if they don't have it on hand, because TennCare is going to want to see it. Then at the end of the application, you can add in comments. And this is where we put things where maybe it's what we think to be relevant to the person's case, but there's not a place to talk about it on the application. It's kind of a catch-all section. So-
Yeah, so in the example you just gave, you might even put in there estimated value. Insurance policy is estimated value.
Yeah.
I frequently do it for something like, they'll ask questions about when somebody's SSDI started, and people won't know that.
Mhm.
I mean, you can maybe make a guess, but so you'll say something like, this is a guess. I do that all the time in those notes.
Okay. It'll also ask about their managed care organization. So which company that partners with TennCare do they want to oversee their program? This is really only applicable when it comes to QMB. And we can put a preference if they have one. If they don't, I just leave it as not answered and move on. And it'll automatically be TennCare Select. It'll ask if they want to do voter registration. I don't think ever had anyone tell me yes. They just say no and move on. But if you do say yes here, then it sends them an application to register to vote. And then here's something that is important to a lot of people. Most people don't enjoy doing paperwork. It's kind of a drag. And so TennCare has made it a little easier to renew eligibility. So what they can do, if given permission, so we need to ask if it's okay with the beneficiary, we can't just say yes and move on, is that they can try to use the tax information to determine if they've maintained eligibility. They can also, down here, check with a credit agency to check about resources before they ask for that particular information. And for many people, if their income hasn't changed significantly and their assets haven't changed significantly, this means that they probably won't have to do a whole mess of paperwork when the next year comes around. If they say no to this, and an addendum if they say yes, but things do change, then TennCare will send them a renewal packet. And the person has to fill that out and send it back in. Otherwise, TennCare is going to stop their coverage that has been happening a lot recently because during the pandemic, everyone just had blanket permission to stay on these programs. That permission ended last year, so a lot of people are being caught by surprise. They've never had to renew before. And because it's catching people by surprise, TennCare has been very gracious and allowing people to appeal decisions well after the final appeal dates. I think in subsequent years, they'll be less gracious because those pandemic protections were less impactful for their decisions. So very, very important to make sure that that the beneficiaries know that to keep this program, they must be on the lookout for anything from TennCare. Cool thing is, if they get something from TennCare and they are very confused about it and they just don't know what the papers actually are saying, which is, I think, very common.
Very common.
Oh.
They're really, really poorly written, the letters. They have all of these things like, you know, they have a whole sheet of paper where it wastes time saying about the Paper Reduction Act at the beginning. And then they also put down like the refusal before they put down the acceptance. So people get, yeah, very common.
Because sometimes there'll be separate pages, sometimes they'll be all in one packet where it will deny them for Medicaid health insurance. And so they'll just see denied and say, crap, I'm out of luck, can't do anything. But then 2 pages later, it says, to make a decision on your Medicare savings program, send this information in. But people see denied and they think the decision for everything is final and throw away the papers. But if they're confused, then you can see if they have an account and help them log in and read the letters with them. If they don't have an account, or if you just don't feel like that's something that you would be able to do comfortably, again, refer them to Christine and I, and because we're spoiled, we'll be able to get in and see and help them out. Ouch, is it not on here? Ah, it's at the very bottom of this application. It's important to note that if we're doing this online for someone, then we should be reading the rights, responsibilities, and penalties for everyone before we do the electronic signature. So it's a bore and it's kind of a lot of work, but it's essential and we can't skip over it. We'll have to read these paragraphs through and make sure that people don't have questions on these or make sure that people agree to these before we sign on their behalf. An important number to give, and we like to give it right at the beginning before we go through the spiel, is to have them write down the number for TennCare Connect. That's 855-259-0701. I think most of us can repeat that in our sleep. And then just refer to that number as we go through. Otherwise, you'll have to say it, 1, 2, 3, many more times. And a lot of this is just, basic stuff. So if someone asks for help catching healthcare fraud and abuse, they've got to help. And you can blow through it really quick. I usually tell beneficiaries that I'm going to speak as quick as I can through that unless they can't understand me, and just stop me if they have questions. And usually I'm not stopped and it only takes a couple minutes to read through. But after that, you should be able to sign digitally. And for that, it's just a checkbox that says that they agree to submit this electronically and that they know electronic signatures have all the weight as a written signature, can be enforced in the same way. And then you just type their name and then you're all done. Okay, that's the explanation of the Medicare Savings Program application. Thank you. It was, I'm sure, the most wonderful thing that you've done since the weekend. Any questions on that at all? Pretty straightforward, just time consuming. When we're doing the application, it's 45 minutes to an hour or so for
Yeah.
MSP.
Yeah, it takes a while.
Yeah.
And this is one of those things where being a volunteer is fun. Because if you decide this is not something you want to do, you don't have to do it.
Yeah.
And particularly when you're first, say if you do want to do phone counseling, but maybe you don't feel like you quite want to do this quite yet, you don't have to. You can pick out conversations that aren't going to involve this. And if it takes a turn and it turns out it does involve this, you can shoot it over to Jordan or myself, so just be aware, I don't want you to think, oh, I don't like this, so I don't want to do this. I want you to think, well, maybe this isn't something that I want to do, but I don't have to. So, so again, remember, any of these things that we're showing you today, if it's not something that you still like the idea of volunteering, helping people with Medicare information, that there's specific parts of doing that that you would rather have somebody else do, you're a volunteer. Somebody else can do it.
I will say though, that this is probably my favorite part of the job,
Yeah.
especially for people that are eligible for QMB. You get such a rush.
You're
It's be a
making a
lot.
huge difference.
Yes, like they only make $1,000 a month in Social Security, and when they first were Medicare eligible, they had, 50 grand in resources. And that's since dwindled down below the 9,000 limit for this program. And they've got medical bills that are worrying them that they can't pay. And then you do this application, you say, seems like you're gonna be eligible. Here's what happens if you do get this, and tell them that they don't have to pay the Part A deductible or the B deductible or the B premium, and they don't have to pay any co-pays, and they get the low income subsidy automatically, and all their worries just absolutely disappear. That is,
Yeah, it's true.
I can live off that easy.
This is the difference for many people between being able to stay in their home
Yeah.
and having to sell their home. I
Yeah.
mean, it's that dramatic a difference. So yeah, you are making a huge difference in somebody's life. You're really helping them. So yes, there's that. as well.
How did you get to that application?
Yes, ma'am. I'll show you. I will show you the best website on the internet. Ship Volunteer Resources, gnrc.org, so Ship Volunteer Resources. And then it says 10 Care Connect. You may have bookmarked it last time. It's standing advice because it's the best website on the internet.
And to be clear, we're saying that the GNRC Volunteer Resources is the best website on the internet.
Yes, that's true.
The 10 Care website is not the best on the internet.
Perhaps on the other end.
I'm on the ship, like I'm on the ship page, but I'm not seeing.
Oh, okay.
Care Connect. Probably.
Other than Field
Let
New
me
York.
look.
Let's see.
That's-
Oh, you're on the Ship TA Center, which is a separate portal.
Just
Oh,
tell them
okay.
the information.
I
Yeah,
think of
you
you
can
as
just
the
open up a new
architect.
tab and you can just search 10 Care Connect and it should be one of the first things that come up. You're using DuckDuckGo. Nice.
Did you ask them?
I did ask for that.
Oh, that, you know why? Sharon was the only one here on Friday.
Right there.
But I
Yep.
also like.
Yeah. That's the one.
Okay.
And Hannah asked me like.
And of course, before anybody does one of these applications, I guess though, Lisa, you're fine. You've done this a million times. We will shadow, and so you guys be able to see our screens as we go through the application. So you can see what it actually looks like and not just the summary. And then you'll be able to do a reverse shadow after that, where you do it and one of us is on the line watching your screens. And after that, you can do them whatever you want.
Well, didn't you say though that this was on the ship page, this 10 Care Connect?
It's not the ship
That's-
page.
Yeah, not the Ship TA
The
Center.
GNRC page. Take a look up at the address there. See where it says www.gnrc.org. And so it's the ship volunteer resource page, but it's on GNRC.
I did say ship though.
Yeah.
I should have put more emphasis on GNRC.
Yeah.
I've got GNRC up here, but I went to the ship thing after you told me.
Mhm. No, I led you down the wrong path.
No, that's okay. No, no,
Go to
no.
the GNRC dot.
Yeah, and this is like
Resources.
a hidden page, so you can't navigate to it from the GNRC website.
Mhm.
Because we didn't want to confuse people who have nothing to do with volunteering, stumbling upon this and it's like.
Okay.
Okay, well, I think that's it for this section. All right, I think what we're doing now is talking about Medigap comparisons, which is something we can find in the SHIP TA Center. You can find the SHIP TA Center by going to the best site on the internet, which is gnrc.org/SHIP volunteer resources, and scrolling all down to the SHIP Technical Assistance Center. Let's see if I remember my username and password. I hope I do. Oh, and I'll go back to show. Once you get in, you go to SHIP login and it'll take you to this landing page. It should look familiar because everyone has asked to be registered as a user. Drum roll, please.
I can't do
No.
it remote.
Ah, I recalled correctly. Well, I've already been defeated because this looks different than it does on my screen. I use a different browser. Let's check menus here. All right, this is looking familiar to me now. So what I've done, and in case it looks this way on your computer, is I've just chosen menu, and we'll go on down to Medigap Plan Finders. And we'll click. This is a very useful tool in our work kit. It does, I think, probably take the longest to load as
It's a very slow loading website for sure. So just be patient and explain to them that you're waiting.
It looks like they've updated just recently the FAQ for it. So I'll have to review that and maybe work it into future trainings. But for now,
Training.
yeah, that's new
That's
too. I
new.
think.
That's
I've not
brand
seen
new to
that.
me. I've never seen a training for this. This
Well,
is interesting.
Feel free to watch that if you like watching recorded trainings.
And we know you do.
Yes. So to access the actual Plan Finder tool, this is just the landing page where it says click here. You can click there.
Have to be patient.
You know, the wheels up here will spin. It takes a while. And it'll take you here where you can run a quote on a Medicare supplement. There are lots of things that you've got to click just to get to the quote search. For once you're here, it's really pretty easy to use. So Medigaps, those are those Medicare supplement insurance policies that go along really well with original Medicare and are illegal to sell to people on a Medicare Advantage plan unless they submit to the salesperson in writing that they're leaving their Advantage plan. All of them are going to cover the Part B coinsurance, the 20% that most people are left after they've hit their deductible. And then the others, I'm sorry, then all of them will cover different levels of different services depending on which one you choose. You can find that information online or I think page 76, 77 of the Medicare and You book. For a quote, it's going to ask some demographic information. For a zip code, I'll use 37076 because that's a great zip code because it's got 2 counties. If you have a zip code that falls in 2 counties, you'll select which one you want to use. We'll say we're going to choose Wilson. And I guess that is kind of unintuitive when you, I don't know, it feels like when you click on something, it should stay checked, but it unchecks it. Maybe that's just me. It's going to ask the beneficiary's age. Frequently, it's going to be 65 because they're brand new to Medicare, but maybe they've been working for a few years and this person's actually 69. We'll say she's female and say that she's never, or she's not currently using a tobacco product. This is a tobacco product. This isn't asking if they smoke, if they vape, or if they dip, use chewing tobacco or pouches or anything. That counts as tobacco as well. So if they use any tobacco product, they want to know that. We're going to say we're looking at a Plan G. I think probably 70% of these comparisons that I do are G's, and then
Oh, yeah.
maybe 25 is N, and the other 5 is whatever someone wants to look at. Automatically, it's going to sort by by price. And then we're going to say the effective date is the 1st of next month. This household discount is kind of cool. If you've got a couple that are starting Medicare at the same time, you can select this to is applied. Some carriers of Medigap plans are going to provide a household discount in hopes to entice a couple to join up together. It ranges between, I've seen 5 and 11%. I kind of default to not apply just so we get the full price. then we ask it to get quote, and these wheels will spin for, well, until they're done. It can take some time.
G and N are the most popular, and it's kind of a self-reinforcing thing. G covers the most that people can now get, people who are born, and not sorry, people who turn 65 subsequent to 2020 cannot get F. So most things cover less than G, and yet some of those will cost more because fewer places will offer them because they're not, as not as many people sign up for them. So it's a cycle that means that G, in a lot of cases, is going to be the best because it's going to cover more for less cost. The exception would be N. People do still sign up for N. N has co-pays and therefore has a lower premium.
Okay. So then precisely what we told it to do, it has done. It's pulled up every single plan G that is offered in that zip code and that county. And it's looked at the person's gender, their tobacco status, their age, and then sorted the plans based on that demographic information. Note they're all blue in this banner here. We're going to go through and change the top few to green just by clicking that banner. And then as I do that, you can see that this progress bar is filling up. So we'll do 5, fill up that bar completely. And then I like to scroll down. What I am going to do is turn on market analytics, change the negative sign to a check mark, or maybe that's just a null bar. I don't know. Turn it to a check mark either way. And then sometimes people want to know the annual rate. We can toggle that on and off. More people want to know the monthly rate, which is what it is going to default to. So once we have those things selected, we'll go up here to the compare quotes button and click that. No surprise, it's going to take some time to do that. Oh, whoa, never mind. Big surprise. That was way quicker than I anticipated. All right, let me eat crow there. So here it's going to give the different plans and their names, the monthly premium for this person, assuming that they're starting at the date that we selected, which is the 1st of June for this particular comparison. And you can see that there's a range here, right? That's 92.50, that's 104.62, and that's what they're going to be locked into. I don't like to toggle annual rate on the other one because you can find it further down here. Some people prefer it up top. I guess whatever floats their boat. It will, if they have chosen to be included, sometimes they've got to pay a fee to get a rating. We'll give them a rating here. So this rating class NA, they've not chosen. NA, not chosen. B, it'll tell you further down which one it is. It'll tell you the type, either community rated or attained age. All of these are attained aged. So that means that as they age, as they grow older, when they turn the next year older, their premium is going to go up. Happy birthday, you're paying more now. Well, how much is the premium going to go up? When we turn on market analytics, it will show us down here, average age increase. So these different plans have different age increases. For this one, about 2.7, 4.5, 3.0, it really can fluctuate. There's also going to be some more information, like if a company's new, it'll tell you that, or if they don't cover a lot of people, it'll also tell you that. I do have questions about this. It seems like 13 people covered is erroneous in some sort of way, right? Or maybe we've
Yeah,
got
it's very
more-
strange.
Yeah.
It's covered 25, yeah.
But it does tell you the years in the market, and that's something that people like to know. Because again, with Medicaps, once you're on a Medigap, hopefully you've used your guaranteed issue right to get one without medical underwriting. As long as you continue to pay that premium, it's yours for life, right? You marry your Medigap. So a lot of people want to know which plan is the best for them. And that's, something we can't say, but we can give them information. We can give them the info about their monthly premiums, how long the company's been in business, if that's a concern for them. If, they are rated highly or higher than others, if they're stable or not. I've never seen unstable. I've only seen stable. Maybe these have opted out. I'm not sure. And years in market is important for some people because that gives them their own, marking of stability, I suppose. But once we've developed this, we can go up here to this PDF button, and it wants to know if they want to include the plan details in the PDF printout. If you say yes to this, it's going to add all of the details for what a Plan G covers. So you'll go to PDF for that, and I'll open this quote real quick and show you. It is annoying. It gives you a very, very fine print, which is great for seniors who need to read this, right? I get a lot of complaints that it's too small. But when you scroll down here on the PDF, that's the only place that you can see this, is the Medigap Plan G details. However, I believe if we back up and we go to print, and we do the print to PDF, throw it on the desktop real quick. File's already in use. How could that be? I'm the only one using it. There we go. It's a little bit larger if you print it to PDF. Now you can't get the plan or the Plan G details, but if they don't care about that, if they just care about the numbers, then I usually default to this because this is a lot more legible. Now let's say you're in here and they say, oh, wait, I thought you meant I was asked if I smoke. I don't smoke, but I do vape or I do use chewing tobacco. Well, you can go back a screen once it thinks about it. Or maybe they've realized they're younger than they thought. Or their zip code was wrong. Maybe they've just moved. Who's to say?
Or they want an N.
Or they want an N. That's actually pretty likely. Sometimes people want to choose between G and N. You can go up here, uncheck these first, and then switch plans. Yeah, that's a good idea. They want an N instead of everything else about them changing.
Another thing to remember when you're talking about Medigaps is the fact that there are these 3 rating groups of attained age, issue age, and community rated. Now, almost everybody winds up going with attained age, but it is important that they know that there are those other 2 options.
Do we have issue aged in our region? I don't.
Yeah, there's like one way down at the bottom, unless that's the reason why I mention it, is because you're not going to see it up in the cheaper ones, since it doesn't change over time or isn't supposed to change over time except for inflation.
Mhm.
Then they charge you a lot more to begin with. And also, again, reinforcing people like choosing the cheaper ones, so it just keeps getting more expensive because fewer people choose it.
Oh. And here's community rated. And that means it doesn't matter what age you are when you first got the policy or what you age, or it doesn't matter how old you've become since you've started the policy. They sell it the same to everyone.
And actually, that seems like a pretty reasonable price for community rated. Is this an N?
Yeah, yes, it is.
Yeah. That's something for me to remember when I get older. It's like, I mean, community rated N might be the best way to go.
Yeah, vast majority. Oh, another community rated. $30 more expensive though.
Yeah. Yeah, and people ask, well, what's the difference between the pricing? Why are some so much more expensive than others? And the answer is there's no difference in the policy. The difference in the pricing is entirely up to the company. This is what they think they can do and make money at doing. So that it does not change at all what is covered for you.
Mhm. Now, some might offer bonuses to go along with the Medigap.
That's something that's relatively new and I'm kind of,
A
yeah,
month ago,
yeah, I'm like, what?
we had someone who has reported that they have gotten, was it an amount of dental coverage or a discount off of dental coverage? Or
Yeah, and like a gym membership, I'm not sure what the dental coverage thing was, but the gym membership, it took me completely by surprise. This is not something that they've previously had.
Mhm. So once we've identified the plans, we'll go up and do compare. I did find one issue,
Yeah,
or
so
very, very low.
you usually get one issue age and one or two community rated, and that's it.
So at that point, we would print this out and either email or mail it to them. And then it would be up to them to contact these companies, especially if they will have medical underwriting, to talk about that underwriting process and to see what they need to submit to go through that process. And again, 3 outcomes for medical underwriting. First off, the company doesn't see anything at all that bothers them, and they will sell the policy at the regular premium. They see something in the medical history that's a little worrisome, and they'll still sell the policy, but it might be double or triple the premium. I don't think there's any cap on that at all. And the third, and what we encounter a lot of times, is that the company sees medical history that they don't like the look of one bit, and they say, we're going to lose money on this, and deny the sale of the Medigap, which is a very frustrating thing for beneficiaries, especially because many of those people are currently going through something medically, and maybe their physician or their nurse says, you know, if you just go back to original Medicare instead of this Advantage plan and pick up a Medigap, then we wouldn't have to worry about these authorizations. You could just get the care that you need. And these doctors and nurses and other medical practitioners don't realize that Medigaps have this underwriting. And they've just given advice that's essentially impossible for these people to follow in their current circumstance. And those are difficult warnings to give. Now, this site does not give the information on how to contact the company. I think that's the one failing for this. They don't have the contact info. However, if you go to medicare.gov and find health and drug plans, you can choose to sort some Medigap policies. And the sorting, at least in my limited poking around, has been the same. So it'll show all of these different things and roughly what they cover. We'll go down to in, do an experiment real quick. And then view policies, that green view policies button. And then it'll show all of the companies that sell those plans. And here you do have phone numbers and websites, and this is pretty easy to use too. So if this is easy to use and it's got information that the other site doesn't have, why use the other site? Well, the other site, gosh, if I can get back to it. Where is that? This progress bar has impeded me. A progress bar. Ah, I saw it. It's tucked back behind this. I can't get to it. Why use the Shift TA Center instead of using Medicare.gov? It's the market analytics. It's so that people can see how much they might be charged in future years. Okay, well, I guess we'll leave that alone if I can't get back to it. How annoying. Oh, okay, there we go. Ah. Close out enough and it became available. All right, so that's the Medigap comparison. Questions on that? Questions on Medigaps? Everyone's an expert. Love to see it. All right. Well, then I think I'll turn it over to Christine to discuss the cost tip sheet. Sorry, Christine. Took our notes and I selfishly forwarded it over here outside of your view.
I was thinking, well, I'm gonna get a nice surprise.
Been very rude. I'm going to give you guys some pieces of paper. The first is the cost tip sheet that Christine's going to go through. Christine, I have an extra for you right here.
Thank you, Phil.
You are welcome. And the second is information about the different coverage phases for Part D, which is less important to this. Focus on the cost tip sheet. There you go.
So every year, the information that we are providing to everyone changes. And it doesn't change neatly and nicely on January 1st. Part of it changes in January, and then part of it changes as of April 1st. So after April 1st, then we have our cost tip sheet, and you'll notice that it says 2024 to 2025. And that is because some of these things are going to stay this way until April 1st of 2025. The things that do change right away, the basic costs of Medicare. So the Part A hospital insurance premium for most people is going to be what? Part A premium. What are most people going to pay for their Part A premium?
Says here 0.
Yeah, so most people have what's called the premium-free Part A. So the majority, over 90% of people in the United States have premium-free Part A. Now, you wouldn't know that through us, though, because we frequently are going to be talking with the people who actually do have to pay a premium. And for them, the Part A premium can be $506 if they haven't paid in anything at all into the system, or $278 if they have paid in something into the system. Again, at the beginning of the year, we'll already know what the Part B premium is. That's $174.70. When you are talking to people about a Part A and B, it is important to make sure that they do have premium-free Part A. Most of them are, those who are new to Medicare that you're talking to. But you want to be sure that that's the case. And you want to be sure when you're talking about Part B that you are letting them know that this is the premium for this year. So I try to be very careful to say, in 2024, the monthly premium for Part B is $174.70. Because I'll be talking with people sometime and they'll think that they're paying like $162 for their Part B, and they'll, they're not, because it's gone up every year. So it's good to let them understand that it will go up over time, particularly people who are on fixed incomes. The Medicare deductible and co-insurance amount. So the Part A deductible, this is important information, but it's not something that I can keep in my head. I can remember that it's around $1,600 for it. But if I'm going to tell somebody exactly what it is, then I need to look at the cost tip sheets. It's going to be $1,632 in 2024. Again, we do know that at the beginning. These first things, these will change at the beginning of 2025. And you can see here the breakdown of it. So if people wind up staying in the hospital longer than that 60-day period, they will have to pay more. Skilled nursing facility coinsurance. This is where that whole 3-day inpatient stay comes in. If you've got a qualifying stay, and you have been in the hospital as an inpatient for 3 days, then when you first go to the skilled nursing facility, you don't have a copay. The Part B deductible, this is pretty much going to affect anybody who's on original Medicare. People who are on Medicare Advantage plans, for the most part, they don't charge them the Part B deductible. But if you're on original Medicare, when you first go to the doctor for things that aren't preventive care, that aren't already covered by Medicare for free, then you are going to have to pay up to $240 before you're going to have Medicare kicking in with their 80%. And then you'll pay the 20%. Unless you have Medigap, of course, which would in many cases kick in and pay the 20%. Remember that the way Medigaps are now structured, they no longer are allowed to pay the Part B deductible. They still can pay the Part A deductible, but they can't pay the Part B deductible. So if you have original Medicare and you've got a Medigap, most people are going to be having to pay that Part B deductible before everything is covered. This is one that again changes every year, and again that we already know by January 1st. The Tennessee benchmark for the Part D that determines the costs of the extra help coverage, like extra help will cover up to that 41, 43 premium for people, and that's why it's important to know what the benchmark is. The deductible is whatever the plan wants it to be. So if you have extra help, your deductible is going to be 0. If you don't, then it's up to the company. The deductible can be something that people get hung up on. For most people, it's not important what the deductible of their plan is. The important thing is how much it's going to actually cost them to get their medications. The initial coverage limit, this is where what both the insurer and the beneficiary have to pay before they go into the coverage gap. So that's this year, that's $5,030. As I say, next year, fingers crossed, there won't be a coverage gap, and the coverage limit should be something along, the out-of-pocket cost should be along the lines of $2,000. That's what the Inflation Reduction Act is supposed to provide for. The out-of-pocket threshold this year is $8,000. Once they reach that, catastrophic coverage applies and they no longer have to pay copays. So the minimum cost sharing was eliminated this year through the Inflation Reduction Act. So they no longer had to pay once they're in the catastrophic coverage. Then the co-payments under LIS, you can see the different levels. And this is why when we're trying to figure out someone's situation, we frequently ask, what's the most you ever pay for one prescription? So if somebody tells you, oh, I've never paid more than about $10, then you're probably pretty confident that they may, unless they have a bunch of generics, that they may in fact have some type of low-income subsidy coverage. If they say, oh, I've never paid more than $4, then it's likely that they might have both Medicaid and Medicare. And if they've paid 0, then they may be in a hospital or long-term care facility for good. So then the next thing is another thing that changes at the beginning of the year. This is the IRMA, the income-related, should be Medicare adjustment amount, not medicine adjustment amount.
I don't think it's either. I think it's income-related monthly adjustment amount.
Oh, I think you're right. I think that's the official name. Income related. Yeah, so this is completely wrong. Apologies. We actually don't create this. This is done at the state level. So it should say income related monthly adjustment amount, though if you say income related Medicare adjustment amount, that's not going to change anything. But that should, yeah, go ahead and cross out that medicine because that's really confusing. This is the amount that people who make over about $100,000 as a single person or about $200,000 as a married couple have to pay. And I've had to talk about that more recently than I've had to previously.
Yeah, the last 3 months or so,
Yeah.
I've had that pop up more and more.
A lot of people. This is also partially, it's probably my fault because I've done a webinar with an investment firm.
Oh,
So we've had some people referred over from that. So and that's fine. I mean, we help everybody. We do not discriminate. Whatever your income level, I've had some people say, well, I can't get help from you because I make too much. And that's not true. They can always get help from us. Doesn't matter what income they make. But it is important to realize that if they do make a lot of money, that you need to let them know that they are going to be paying this extra amount. And you can see that that can be fairly substantial for the Medicare Part B. Again, most of them are going to have premium-free Medicare A. For Part D, it's not usually too much, but still, it's a little extra out of the money each month. The premium subsidy, the low income subsidy here, you can see that it's going to be covered 100% if it's below the benchmark. You got that 41, 43. What I only just found out is that, and it doesn't say here on this, and it should, is that there are some cases where even though the premium is below that benchmark, they may still have to pay the premium if the plan is considered to be an enhanced plan. And how do you know whether it's enhanced? Well, if you brought your Medicare and U-Book, you can look in the back and you can see which Part D plans are considered to be enhanced and which ones are considered to be basic. So for the enhanced plans, they do have to pay the premium. Now, oddly, this is like the one that cost 50 cents as an enhanced plan, so they do have to pay that 50 cents a month, but fortunately, it's only 50 cents a month. And then I think there's one that's $11 and something. Do they have to pay all of it or part of it?
no, it's the SilverScript Smart Saver. It went from maybe $12.30 down to $2.20.
Okay, so on that one, they have to pay for even more confusingly, they have to pay for the part of it that is enhanced.
Mhm.
But they don't have to pay for
The
the rest of it is covered by their low income subsidy.
handy thing is that if you are doing a low income subsidy plan comparison, so someone has extra help and you're doing a plan comparison, Medicare.gov, the figures in Medicare.gov should be correct.
Yeah,
So it doesn't matter if it's basic or enhanced, it will tell you
it'll show you the correct
how much they
information.
can pay.
The tricky part is when somebody is qualified for low income subsidy, but they don't have it yet.
Yeah.
So you need to be a little bit cautious when you're doing your comparisons and be aware of that situation.
And I suppose you could still do a plan comparison just outside of an account.
You would
but-
have to do it, yeah, see, and I had to do this for another reason the other day. It's kind of a pain because then you have to, if they have a lot of medications, and in order to
Mhm.
see it, then you would have to like enter in all of their medications and use their zip code and not use their account. In most cases, it's not going to be worth it. In most cases, it would be better to just take a look and see if the comparisons that you're doing, see if it's enhanced or basic by looking in the back of Medicare.gov and just let them know. Say, okay, so what your actual premium will be this much. Because if they don't have the LIS on there yet, then all of them are going to be shown as full price anyway. So you can tell them your premium should be lower on most of these, but on this particular one in the comparison, it's going to be this much, and this one, it's still going to be 50 cents. So let's see, level 1 and level 2. That's weird. Oh yeah, I see. They're showing so the reason why they have the level 1 and level 2 is for as we were talking about previously, whether they have, if they just have Medicare and the full extra help, then it's that 450 for the generic and 1120 for the brand name. But if they actually have Medicaid and extra help, then it's the 155 for generic and the 460 for the brand name. So the one that is weird and that you don't find out about until shortly before April 1st, and then it takes effect April 1st, is the Medicare savings programs. Again, these change every year. You are not expected to memorize these. Do not feel like that you in any way have to. All of you should have the brochure that we do each year. If you don't, I'll give you another copy. And these brochures are really, really useful. They have a lot of information. I keep one by me when I'm counseling at all times to make sure that I can ask about whether people meet the guidelines or not, because that's an important part of what we do. Questions about the cost tip sheet? Questions about anything?
Where did you say it showed the enhanced, if it was an enhanced
So
plan?
it should be in the back, and I actually don't have Medicare new book, but it should be on those Part Ds. Thank you, Rebecca.
I want to say they're indicated by a different color
I think they are, yeah.
or italicized, or there's an asterisk, or
So Medicare prescription drug plans. So we know for sure that it's like Silver Script. Okay, if you qualify for full extra help and the premium amount is blue, your premium for that plan will be 0. So if you look on page 127, you can see that none of those premiums are blue. If you look on 127A, you can see where the premiums are blue.
does that have Clear Spring at the top?
Yeah, it does.
That's misleading, I think.
So people can't be in Clear Spring anymore? Is that what's going on now?
Yeah, they had the sanction last year, so people that were in Clear Spring were allowed to stay in Clear Spring this year, but they could accept no new enrollments last year and no new enrollments this year either. And they leave the area completely starting January 1st.
I guess it's just so that if you're in Medicare.gov or something and somebody already has it,
I
you can
suppose.
check.
Yeah.
But you'll notice on 127C that the WellCare value script, the monthly premium is in black, 50 cents.
And I haven't heard too many complaints about having to pay 50 cents if they've got the low income subsidy.
Yeah,
$6 a year is not very steep for,
even
Drug
for people
coverage.
who are watching their pennies, it's not too bad. But yeah, unfortunately, we have definitely seen a trend of fewer drug plans available and those drug plans that are available having higher premiums. I don't know what'll happen next year. My fingers crossed that it's good for you.
premiums are gonna hop, right?
I assume premiums are gonna hop.
Okay, so the next thing that we're going to be doing, you've been warned, the time's come. We've got scenarios, which includes a level of role playing. Someone will play the part of the beneficiary and someone will play the part of the counselor. And don't worry, we do have 3 scenarios, so everyone will get to play both parts. It's not really as bad as it sounds.
Well, and actually, in the old days, we always used to have one person sort of be the observer who would report back. And since we have 3 of you, I suggest we do that again so that each of you rotates as all three of you are equally involved. That is, one of you is going to be the counselor, one of you is going to be the beneficiary, and one of you is going to be the person who reports back on how it went. I also,
Why do you keep looking at me?
I don't know. You're right across.
I also recommend that you make it realistic and that you have a phone call, that you have your hand telephone, and that it rings and that the person answers. And yeah, I mean, I'm sorry that we don't have the counselor, an experienced counselor with us today, but yeah, I have fun with it. So I guess we could proceed.
Sure. Okay. Do we want to go ahead and assign a round robin, or does someone want to?
Is there somebody who's dying to be the counselor?
Yeah.
Somebody want to start us off? Because that's probably, I mean,
Start as beneficiary since it's the first.
okay,
role.
Okay. If you're the beneficiary, then we'll say, Lisa, you'll counsel on this, and Melissa, prepare to observe. All right. So beneficiary, you can go ahead and read this out. And feel free to assume a character if you like.
yeah,
Change with an accent.
I would go ahead and call. Beneficiary, I would read it to yourself and then go ahead and call the counselor. You ready to ring her up?
I'm ready to ring you up. Beep,
Okay.
beep, 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 beep.
Hello.
Hi, is this, where I talk to someone about Medicare?
This is Ship. I'm Lisa. I'm glad to answer any questions that you have. We're, FaceTiming or something.
Hi, Lisa. My
Because
name's-
it's just weird.
Yeah. My name's Stephen.
Nice to meet you, Stephen.
I have, healthcare through my employer, but I'm getting ready to retire. I'm 68. And so I just want to make sure that, for Part B especially, I've heard there's all these penalties and things because I'm over 65. I'm 68 now. So, what am I getting into with this? Mainly in Part B. So I've had coverage through my employer.
Well, in certain instances, there are some penalties for late enrollment in Part B. But I'm just now training, so I'm going to have to call in for help. So, hello, Jordan.
Howdy. Do you recall our discussions on special enrollment periods?
I do indeed. So if hypothetically, if Stephen were to enroll during a special enrollment period because of his now retiring, he would not have to pay an enrollment penalty.
That could be correct and likely is if Stephen has had creditable coverage through his employer.
Stephen, please hold. Do you know if your employer has credible drug coverage? That's something that you would have learned from your HR department. And depending on the number of employees, if you have a large number at your company, it could very well be credible coverage.
I'll have to call them, ask them about that because I don't really know what that means. I just know I've had, basically coverage through my employer for the last however many
I
years.
understand that certain companies do have what's called credible coverage, and that's an equivalent, and that might be a way that you would not have to pay a late enrollment penalty.
Mhm.
But that's something that will require a bit more research.
Okay. Well, will my employer have a Part B plan?
Your employer will not, but they will be able to tell you whether or not you've had credible coverage, which would help us determine whether or not you'll have to pay an enrollment penalty when you enroll in Medicare.
Okay, that's a good starting point. I have your number, so I may call you back.
Sounds great. Thank you so much. Good luck.
Thanks.
Okay, Melissa, your thoughts. What did you hear? What did you think?
Well, first of all, that they're both really good at role playing.
Good point. Yeah.
I liked how she explained to her, this whole thing with her employer and checking with them first. I would have been happy with that interaction if I was calling and checking,
Was there any information that you felt she could have given? Anything else she could have mentioned?
No, not really.
Okay.
Some employers, may offer a Part B,
No,
no?
no,
Not a Part
Oh.
B.
no.
Or have,
No employers offer a Part B.
Now, some employers, as part of their retirement benefits, might have partnered with a particular Medicare Advantage plan.
mhm.
And I've seen a couple of cases where there's a reduction in the amount that they pay in the Part B premium. So one of the school systems around here, they pay 70-something dollars a month instead of the full Part B.
And
premium.
some of them used to have like their own coverage that supplemented Medicare, and now they've switched to a Medicare Advantage
Mhm.
plan. And the state, for people who started working before July of 2015, has something that's a supplement that is similar to a Medigap G. Yeah. So the main thing, so there were two things that I was thinking. One is that you said drug coverage rather than medical coverage, and really they have to have creditable coverage for
Well,
both.
I forgot the Part B benefit and
Yeah.
I was,
For
I'm
both
still
drugs.
training.
And yeah, no, absolutely. And I really, really, really liked that you were like, okay, um, this is what I think, but I do need to call somebody and get some more information on this. I would say that in general, you're probably not going to want to put them on hold. You probably, I mean, in this case, you happen to know that Jordan was available. You could look across the room and see that he was in fact available, but you're not always.
Call him.
He
answered.
But you're not always going to be. It's usually going to be better to say, let me get back to you on that. I need to check on a few things. Or you can, if it's really complicated, you can say, I'm relatively new. Would you mind if I had a more experienced counselor call you back, because I want to make sure that you get these things. So in either case, it would probably be better to set up like another time to speak with them and then get in touch with us. You can go ahead, even if you're not sure about creditable coverage. In this case, this is a very specific scenario, but just in general, you can go ahead and give them a little bit more information about things that you are confident about. Like, okay, you're going to have some choices to make with your Medicare. Once we've gotten this figured out, then I can help you with the plan comparison. Let them know what else you can help them with.
So this scenario, they were only asking about Part B, but should anything come up about Part A or D, since they're retiring,
Yeah.
right? So
Yeah.
just, if you're talking about Part B, and that's great, you're
Yeah.
thinking ahead, but you also need to consider what you're gonna do about Part A and Part D.
Absolutely.
Descriptions.
Absolutely. So what is the situation likely to be with their Part A? What were we talking about earlier with Part A, when we're talking about the cost tip sheet?
Oh, yeah, that's probably gonna be no.
Yeah, so
Possibly.
yeah, almost certainly, it's gonna be no problem at all.
Did they not have gone on and signed up for Medicare when they turned 65 and had dual enrollment in Medicare and their employers?
So most people don't,
Depending on the
Want
number
to
of
do
hours that
that,
they're working
'cause
and
the
things like that
cost-
too.
the cost is like, there's really not a good reason most of the time to have both B and your Medicare coverage. There may be a reason to have Part A. It's not gonna
That's what I was
cost.
asking about, is Part A.
Yeah, Part A. So if you have a health savings account, then you can't keep contributing to your health savings account if you sign up for Part A.
Yeah. You have to do that, what, 6 months in advance?
You have to stop contributing to your health savings account 6 months before you sign up with Medicare, if you're doing it later on. If you're doing it when you first are qualified at 65, you don't have to worry about it. But if you delay enrolling, but that could be a reason why somebody didn't sign up for Part A, or maybe they just didn't think about it. Some people just don't even think about signing up for Part A when they turn 65.
Saying the cost is so high through most healthcare agencies, or I just don't understand why they wouldn't go on and enroll in that if they're eligible. Is the work gonna affect? That's my question, I guess.
It could be, or it could be that they are the spouse that provides the other spouse coverage, and they're no longer able to do that if they lose their employer coverage.
And also, it depends on the employer. Some people
Yeah.
have a real sweet deal on their insurance coverage. And in fact, it's a real shock to them how much more that they're having to pay.
I've
When they
never
go
been
on
that
Medicare.
fortunate to have a sweet deal on any.
Yeah, I mean, it happens though. I mean, there are some people.
Now, but before, for the
Yeah.
last, 20-some years, oh no.
There are some people for whom getting Medicare is a relief, but there are some people for whom it's a financial blow because they're having to pay more than they have previously. But all that's expanding way beyond the scenario, just because we've got plenty of time. And sorry about having plenty of time. And let's see what it says.
So yeah, Stephen can enroll in Part B. He'd go to Social Security and request to join Part B, do the application. And he will likely not have to pay a late enrollment penalty or face gaps in coverage. He has a special enrollment period. This is assuming that he has that creditable coverage. In this case, he's eligible for it because he had that coverage. And does anyone remember what that enrollment period is?
Boy, your HR is quick.
They're on it.
Talking about the open enrollment?
No.
Not yet. The special enrollment period when someone loses creditable coverage through their employer or through a spouse's employer. It's a tricky one.
Yeah, remember, creditable coverage is only through active employment.
Yes.
It's a relatively narrow category. So it's active employment, usually with employer of 20 or more people. So yes, so you may lose it because your spouse retires, or you may lose it because you retire. And you have a certain amount of time to get your Part B with no late enrollment penalty. So what Jordan is asking is, do you remember in that situation how long that amount of time is that you have to get your Part B? It's okay if you don't
4
remember.
months?
Oh, maybe double that.
Oh, okay, 8 months.
Yeah,
Nail on the head. Look at that.
I was gonna say 6.
no.
I was gonna say 6. I thought was too long, so
Mhm.
that's quite a good window of time,
Yeah.
It's
8 months.
It's substantial.
But here's the tricky thing, is that if they are also needing drug coverage, they only have 63 days to pick that up. And a lot of times, someone will think that 8 months covers the whole kit and caboodle, right? They've got 8 months before they have to make any decision at all, and they'll put it off. Well, if they do that, at the end of 63 days, they start incurring late enrollment penalties for Part D, that 1% permanent penalty for each month they could have had coverage but didn't. And then they might be stuck until open enrollment, until they pick up Part D in October through December, and then it starts in January. So they might have some months there that they are gonna have a period or a penalty that's gonna be permanent and it'll never go away. So while they do have 8 months special enrollment period when they lose creditable coverage, we kind of lean pretty heavy on the 63 days for the drug coverage.
Yeah, and for most people, they are wanting to have coverage anyway. They're not wanting to have a gap between their coverage. And what is a lot more expensive than employer plans is COBRA. COBRA is not creditable for Part B, and it costs a lot more. So that's the one where I don't understand anybody who's talking to me about, well, I can get COBRA for a few months and then enroll in my Medicare. I'm like, you could, but why on earth would you want to? So,
Overall, it's the best to enroll when you need to.
yeah, in general, to not,
Unless you have some, like you said, some kind of a sweet deal with your,
well, I mean,
even then.
yeah, I mean,
There's
you don't have a sweet deal that lasts past your Medicare, once you are no longer working with them, your sweet deal is gone.
Right.
My sister did pretty much the scenario, but she didn't retire. She was 68 and is still working for a very large company and just called her HR department and asked her, like, what's my options with Medicare? And she ended up getting on the Part B, but she relied heavily on her HR department. So hopefully they gave her good information. It's been a year, so.
Yeah, I was been emailing back and forth with an employer. And I'm concerned that his idea is that he wants to shift the cost burden from the employer to Medicare. And I've tried to make it clear that no, he can't tell everybody this is how much you're going to be paying because it's going to vary from person to person. And that the best idea is to send them to us and let us counsel them individually. Because yeah, it is worrisome that they're not allowed to, these larger employers, if you are on their plan and you are eligible for Medicare as well, they are not allowed to kick you off their plan. They have to allow you to stay on their plan. But that doesn't mean that they can't be a little sneaky about it.
All right, we'll move along to scenario 2.
Great discussion, by the way.
Very
Good
good.
questions.
And how about we just shift down one and we can have Lisa be the beneficiary and Melissa the counselor.
And Melissa, you want us to do this because the third one is a doozy.
Third one is a doozy.
Can't act, I'm sorry.
You don't have to.
Yeah,
act.
don't.
Just
you
count.
don't actually
Time
have
too,
to.
because it's just weird.
All right, we'll start.
Do answer the phone. You can answer the phone.
Here's scenario 2.
Ring, ring.
This is like. And am I supposed to be answering a particular way?
Yes, that's a really good question. Go ahead and make an attempt as to how you think you would answer if somebody called you up and you were being ship counselor that day.
Hi, welcome to SHIP. This is Melissa. How can I help you?
Hi, Melissa. I'm Abby. I have some questions I'm hoping that you can help me with.
Okay, Abby, I'd be happy to see what I can help you with. What's your questions?
Well, I am 92. I have original Medicare and I need some help paying for my Medicare Part B benefits. So I applied for a Medicare savings program and then I got a letter in the mail and I'm not really sure what this qualified individual program means. Apparently it's supposed to pay part of my monthly premium, but Social Security is still taking my money and I have dogs to feed.
Okay, let me see what I can do to help you here.
And I think it's been almost a year.
Almost a
They're
year.
still taking the money out of my account. And I only get $1,000 a month and I'm really struggling.
All right, you've already applied for the.
I have, and here's my letter. I would show it to you, but yeah, my phone is a flip phone.
Oh, okay.
So sorry.
All right, okay. All right. I know we just went over this. I'm not talking to her, I'm talking to you.
Sure.
And so I really don't know where to go from here.
Okay.
Phone a friend.
I'm sitting here trying to find out what.
So go ahead and do a little bit of role playing still. And what would you say to her if you didn't know how to answer her question?
Okay, Abby, I'm new to the program here. I want to check with some of my resources first before I can give you some answers. So can I take your your number and give you a call back. I'll get back with you a little bit later today, I'm sure.
Oh, that sounds so good.
Okay.
My number's 867-5309.
All right. Okay, Abby, I'll talk to you later.
Okay, thank you so much.
Yeah, great,
Yeah.
great. That was really good. I liked how you talked about SHIP program. You let her know that was. I often say SHIP Medicare counseling, just to make it clear that that's what we're doing. And your interaction with her was great. And of course, Lisa is amazing. Lisa, I completely believe about her dogs.
Mhm.
That's so cool.
She's so good. She just-
You're so good at this.
I hear it every day.
The flip phones. I mean, you
It's
definitely.
because all they have are flip phones.
Yeah.
I have this smartphone and I don't know how to use it. So, yeah. Poor Miss
Yeah.
Martha, she's not gonna make it today until I get there.
Yeah, no, you're channeling all of these people really well. And Melissa, yeah, I thought that was really good. So do you remember about the Medicare savings program? Do you remember what she's talking about?
Yes, yes.
So she had a letter that said that she qualified for it. So what does that mean, do you think?
That she qualified for it.
Okay, so where do you think the problem's coming in? They're still taking out her money.
I don't know, is there a time period where before it comes into effect? Like, is there?
It's a really good question,
You know,
right? So how long do you think that time period might be?
At least 12 months.
Yeah, no, that's really, really, and that would be an excellent question to ask is like, how long has this been? And she told you seems to be almost a year. Does that seem like a reasonable amount of time for
No.
them? No, it doesn't. Yeah.
there's something that's,
Maybe is there an action in the letter that they have to take?
It's 45 days because if you
That's
don't do
right.
something within
45.
45 days, then they want you to call back and complain.
Right. It's 45 days. But in this case, that's not the period of time that's under review because the 45 days is them making the decision. And she actually already had that letter. So it's a different time period that we're looking at. So what does that mean? That she got that letter and they've made the decision and yet they're still taking it out? What do you think that means?
um, I really don't know.
Okay, it means that they screwed up. She
Or
has,
Say something like that.
Yeah.
It sounded kind of.
yeah, no, you wouldn't say that. You would say something like, it sounds like there's a mistake, and you would get the date, like what is the date of that letter? And you can definitely contact me and Jordan. And you can say, you would need at least her name and birth date and ideally her name, social security number and birth date. And you can say, I have this person. And according to the letter that she received, then she is supposed to have been not having this deducted anymore and it's still being deducted. Can you look it up and make sure that she is in fact signed up for this program? And then Jordan and I can verify that. And then if she signed up for that program, then we know there was a mistake.
So once again, because they're calling us, then it's all right to, ask for that personal.
Absolutely.
information.
And you would reassure them, particularly with a 92-year-old. I definitely, when I'm speaking to somebody who's over the age of 85, they are frequently, and it's a good thing, very cautious. So you can definitely, reassure them, well, you called us up. If you want to look on the back of your Medicare and you book, is that the number you called? Well, that they sent you to me. And that is why I am calling you because I received that message. And then frequently, in our little things, we'll have a notes here and it will say specifics about what's going on with them. And you can read that back to them. And that frequently reassures them because they know that they provided that information.
So, any idea what to do? What to tell the beneficiary to do?
What do we say if it's something that we can't fix? What do we do?
We send them to the people who can,
Yes.
Nice.
which is,
Who would that be in this case? Who runs the Medicare Savings Program?
security, huh?
Social Security.
Social Security.
No, not
No,
Social
even they're the
Security.
ones that are
This is
taking it
very
out.
important, very important that you know who runs the Medicare Savings Program.
That's it. Did we learn about this?
We did.
Did earlier
been on the
today, in fact.
Oh.
We were talking about a particular portal.
A portal,
Here.
the.
There we go.
Care portal,
Yeah, that's exactly right.
if I'm looking at it right here in front of me. It was one of my tabs I had.
So TennCare has to tell Social Security they're covering the bill. In
Ah.
fact, we have one region in Tennessee where people have the Social Security come out of their check, they go to Social Security, and Social Security is directly giving them the ship person's personal phone number. However they got that, it's
Their
it's a-
office.
it's a- oh, that's right, but their direct line.
Their direct
Direct
line.
line. So it must go to Medicaid. TennCare has to say, we've made a mistake. We'll honor this. They have to talk to Social Security about it. Now, here's the cool thing, is that Abby has something called a protected filing date, which means they have to handle this situation as they should have. So if it's been a whole year and poor Miss Abby has lost out on the Part B premium each month, which is,
So bad for the dogs.
oh yes,
Oh,
they've
I'm
gone
gonna do
so
one,
hungry.
Cause I'm fixing to get a check.
Yeah, so they should be able to get a reimbursement for Abby to make her whole, recoup all of the losses that she had that she should never have faced. So once the problem is corrected at the Medicaid office, once TennCare knows what's going on, then she should get that check for the past Part B premiums. And from that point forward, she should no longer have that deducted from her Social Security unless she's no longer eligible for QI1, which is the, I guess, entry tier of the Medicare Savings Program. So the first one that someone might qualify for.
So TennCare has to communicate with Social Security.
That's right. That's right. And sometimes we'll get issues with MSPs, particularly QMB, where TennCare will say it's a Social Security thing, and Social Security will say it's a TennCare thing. And if you encounter that, there's a complicated fix, and it may be easier just to let us know about it so we can email TennCare and say, hey, something's going on here with this beneficiary. But in a situation like this, typically, if we can prove that she's supposed to have had QI1, a call to TennCare should fix the problem. Maybe not very quickly, but should fix the problem.
What does the QI stand for?
Qualified individual.
Qualified individual,
Mm.
level one.
Assumption on level one. I'm not sure why the one's there.
I don't know either.
Yeah, it's a grant funded program, so maybe that has something to do with it. Maybe there's grand designs for eventually introducing a QI2.
Random number.
I think, yes,
That's true.
I think that's
Income
probably
level?
the answer.
Didn't you say was something about the level though, that?
Oh,
QI1
it's,
No, Jordan was saying.
that's true. I called it the entry tier.
The entry tier.
You're
that's
right, because the first thing that they'd qualify for is extra help, then QI1 and SLMB.
That's not an official ranking.
Okay.
That's just
Yeah,
how we
that's-
think about it in terms of like, if you make more money, but you still qualify for the Medicare Savings Program. And then as you make less and less money, then you can qualify for the SLMB or the QMB. For most people, there's really not going to be a difference between the SLMB and the QI1.
Yeah.
All three of the Medicare savings programs do what? This is really good. We can do some review here for the test. What do all three Medicare savings programs do? This includes the QMB, the SLMB and the QI1. What do they all have in common? What do they all do for somebody who gets them?
Probably part of your premiums.
They pay for Part B premiums. It's important to differentiate that because only QMB would pay for Part A premiums. So there are people who need their Part A. Remember, I said that we talk to more than our share. Well, I shouldn't say more than our share, but we talk to a disproportionate number of people who don't have premium-free Part A. And it's important to realize that the only way that they can have that covered is if they qualify for QMB. They're not going to be getting their Part A premium paid for them if they have SLMB or QI1. It's only with QMB.
It's only Part B.
So with SLMB and QI1 and QMB, all three of them paid for the Part B premium. But only the QMB will pay for the Part A premium for those rare people who need it.
Another good discussion. And well done, counselor.
Yeah, well
Yeah.
done.
Say you can't act. I think you did well enough.
You did fine. Well, the thing is, it shouldn't be acting really in this case. It should just be, what would you actually do if you were counseling somebody?
So you said you got their name, date of birth, and the date of the letter, and then
I didn't, but that's
To-
what I will next
would
time.
have done, yeah.
So
And then what,
name, date of birth, and then either social security number, or if they don't want to give social security number and have a TennCare letter handy, there's a person ID on that. They can give us that instead of social security number. But many times with these problems, they don't have a letter handy and have no idea what their TennCare ID is, but do know what their social security number is. So if it's okay with them for you to collect that information and then send that on to us and check their account in the portal.
And you need to let them know why you're collecting it and to
Yeah.
get their okay, make sure that they say. So what I'm doing is I'm going to be getting this information and then a counselor is going to look up all of your information. Is that okay? If they're unwilling to give you, they don't have the person ID and they're unwilling to give you the social security number, but they're okay with you having their birth date, we can still, if you have their name spelled correctly, we can still check a certain amount of information, get a little bit of information usually. We could probably find out if they have the QI1 or not, something like that. Because we can go into a different state website that used to be all that we had. So I'm very grateful. Now we've got the portal, but yeah, we can still get some info.
So we wouldn't reach out to TennCare. We would pass it on to you.
Absolutely, yeah. You're not going to be, you would have them reach out to TennCare in most cases. But if it were something that had been, they had already contacted TennCare several times and it still wasn't straightened out, then yeah, you would contact Jordan or myself and we would try to figure out what we could do.
So that would be another question I could ask her, like, have you reached out to?
Absolutely. Have you contacted TennCare? Because the letter that she had, it should have the phone number on it, should have that ubiquitous phone number. And she should.
TennCare answers the phone, and I actually there's a girl and her name is Journey that applied for the QI1 for one of my little residents that her income kicked her out, and for the pickle program, which I thought was kind of interesting.
Pass along.
Pickle along.
Yes.
Pass along.
Yeah.
Yeah, I'm fascinated by the pickle pass along, I have to say.
She was really good.
Good.
It's interesting. Pickle, huh?
Yeah, named after a man, not after the pickled cucumber.
And it's not spelled like the pickle, it's got an EL instead of an LE. But basically it boils down to if somebody received a supplemental security income check and a social security check in the same month,
Yeah.
then they qualify to continue receiving Medicaid coverage, even if they no longer would qualify under the usual assets and income rules. So again, it's a relatively rare
Mhm.
situation, but it's not unheard of.
And we see it typically happen when someone's cost of living adjustment outpaces the adjustment in the income requirements.
My little lady just happened to get a widow's benefit that
Survivorship.
knocked her over
Yep.
it.
Yeah.
That'll happen too.
And luckily, we got Journey and she was like, I can help you. It's like, okay. And they answered the phone, which Social Security does not do. TennCare
Thank you.
does.
Doesn't always answer the phone either. I'm
Oh, I've
surprised.
had great luck with TennCare.
Really?
Call the
yeah.
0701 number?
Whichever one's on that letter.
Oh,
Really? That's fascinating. Okay,
Fun thing.
And they'll call you back if they cut you off.
that's good.
But Social Security, I've been waiting, for an hour, hour and a half.
we hear 30 minutes to up to 2 hours in extreme cases for a TennCare wait.
Yeah. So we're surprised to hear that they've been answering the phone at TennCare.
Yeah.
And I haven't just heard that.
It's sheer luck.
Medicaid customer service.
Under,
She was wonderful. She's like, well, I'm going to do this, this, and this. And my little lady's sitting there. She's just pacing back and forth. And she's like, well, we can try this. And she was really, really great.
All right, let's move on to scenario 3. And again, we'll shift. So I believe Lydia may now be the counselor.
Lydia.
But yeah, that's the way it goes. And that means Melissa, you're the beneficiary.
All I gotta do is read that.
Kind.
Lisa, you'll be the observer. Are you ready? Mr. Q?
You can just make it Mrs. Q.
Oh, yeah, we could. Are you ready, Mrs. Q?
No, I'm reading it.
Okay.
This is a long one.
Yeah,
It is.
I told you they get harder as they go along.
Okay, I guess. Ready?
I'm gonna give Lydia a call.
Ring, ring, ring.
Tell you what, Lydia, give her a call. Give Ms. Q a call back here. Say you read this on the call sheet or you just read that Ms. Q wanted to call on the call sheet. So give Ms. Q a call.
We talked about this kind of scenario.
We
I
did.
just, yeah.
Yeah. Go ahead and give
Great.
Ms. Q a call.
Hello,
Hi, is this Mr. Q?
it is.
Hi, my name's Lydia. I'm calling from SHIP. I have your name and number here, that you requested a call back.
Yeah, I'm really confused about my Part D plan and my Medicare, my Medigap.
Okay, so, I have some notes here that you had left before saying that, you had talked to someone about a Medicare Advantage plan. But you decided not to enroll, and it seems that maybe you were, because your doctor said that your insurance has changed and while he can still see you, the payment will be not what you expected.
Right,
Is that correct?
yes.
That was maybe an abbreviated version of your circumstances. Okay, so what can I help you with? What would you like me to help you with? Did you get anything in the mail about a new insurance plan?
No,
This is a hard one.
It is.
yeah,
Keep
I
going.
don't really know what to ask.
Get all of this in your head and then put it out.
Okay, so you didn't get anything in the mail that said you had a different, did you get anything from the plan you had last year that said you would re-enrolled?
Yes, I did.
Okay. So you have that and it says that you're enrolled in the same plan
Yeah.
in your Medigap?
Yes.
Okay. Did you check with your new plan to make sure that your doctor is still covered under your plan? Because that can change year to year.
I probably didn't do that. I just assumed that he would because, you know, he's been my doctor forever. So,
Is that something I can check or is that something?
It's something we usually send people to their physician to check.
Yeah, you can take a look at the plans online, but that doesn't necessarily mean that that online information is accurate.
Right, yeah, especially when it comes to the provider listings.
So what is the actual problem here? So ask Mr. Q, what Mr. Q wants. What,
Yeah,
you know, what Mr., find. So Mr. Q, he decided not to enroll, right?
right. And didn't get any information that he actually did enroll. So, but he got the the previous Medi-Cal.
Right, so,
Paper-
but remember, Medigap's don't have networks. So what's going on if Mr. Q is being told that somebody's not in Mr. Q's network anymore?
Well, somebody took advantage of him and took away his Medicare A and B and his prescription drug plan and put him in with the $200 grocery plan. And
You can eat, you just can't go to the doctor.
you can get some over-the-counter meds.
Well, that may have very well been what happened. So if Mr. Q talked to this broker or agent and actually said, never mind, I don't want to enroll, but it appears as though he has been enrolled in this plan, what do you think Mr. Q should do?
Care. See what plan he actually does have
Mm-hmm.
and then try to rectify it. And then, maybe call the doctor's office and let them know that you believe there may be a mistake with Medicare and that make sure that, yeah.
Yeah. Maybe given the heads up that it seems like something with Medicare had changed when it shouldn't have, and
Trying to sort it out.
yeah, tell them to hold on the billing until it gets sorted out with Medicare, and then they can bill Medicare. Yeah, this is a tricky one for sure. So let's go to the debrief. So if Mr. Q was enrolled in an Advantage plan and he didn't give the okay, then we can contact Medicare. So our certified counselors can get a unique ID. It's a backdoor identification number. We can call Medicare. I've never been on hold longer than a minute, maybe minute and a half, super quick. And then we can just say, hey, we're on the line with Mr. Q, and it looks like he was enrolled in an Advantage plan without his consent. So then if Medicare agrees that the agent or the broker or whatever representative did it without permission, he can be retroactively disenrolled from that plan. So it makes it look like he was never in that plan at all and still have his original Medicare in the month of January.
So they do retro.
Yeah, they can in these cases. Medicare can make that happen.
Could that be considered fraud by the other?
Absolutely.
Oh, yeah, not just could be, that is textbook.
That's fine.
Yep.
You would, when you're doing your contact, you would make a little check mark in SMP. If in fact they knew the name and the number of the person who did that, then you would want to send that along either by an email to Lonnie Holloway Hitchcock or, let Jordan or myself know, and we would send it to Lonnie Holloway Hitchcock at SMP to let her know that there was this bad actor, because unfortunately the stuff that goes through on SMP, I don't think
Yeah,
it's not acted on. They just keep count. But yeah, absolutely, that's fraud. They're pretty generous. You might say, well, anybody could call up and say that they had been deceived. But Medicare tends to take people at their word on this. There have been just lots of bad actors in the past. They also have the same thing applies, even if they did want to sign up, but say they were misinformed. They were told that their doctor was in the plan, or a hospital was in the plan, and or a medication was on the plan, and then it turns out that they weren't, same thing. You can still call up. In that case, it's more abuse rather than fraud. It was probably an unintentional error. But then look at the second part of this too. Because,
Yeah, maybe he had consented. Maybe he did say, okay, I'll join this Advantage plan. But then he goes to his doctor, and in this case, he didn't check with the doctor first. He didn't make sure that the doctor was part of that HMO that he joined. And gosh, that doctor's visit is pretty expensive, and he's changed his mind. Well, then he still has an opportunity to go back to original Medicare. Because in the first slide, he's making this change during the annual enrollment period, which runs October 15th through December 7th, and it started in January. The coverage started in January. Well, there is a Medicare Advantage open enrollment period that runs from January 1st through the end of March. And it's when someone in a Medicare Advantage plan can make one change to how they get their Medicare. That can be moving from that Advantage plan to a different Advantage plan, or in this case, potentially going from a Medicare Advantage plan back to original Medicare. However, if he's waited too long, there could be a problem getting that Medigap plan back, because after the guaranteed issue right, there's very limited ways for someone to get a Medigap plan without going through medical underwriting. So if Mr. Q has a lot of health issues and he's been on an Advantage plan for a couple of years, he might go through underwriting and find out that he's not accepted in that plan. However, for this reason, so say
yeah,
he made a change during annual enrollment and it started January 1st, that means that Mr. Q is in his trial right period, which is really important for people that are going from original Medicare to an Advantage plan. The trial right is for people that started original Medicare with a Medigap. They have a 12-month window where they can test the waters with an Advantage plan. So Mr. Q, he's tested the waters. He doesn't like it. He wants to go back to original Medicare. That should be okay. As long as his Medigap provider is still selling that policy, if he goes back to them within 12 months, they need to start selling that policy to him without medical underwriting. That's, I think, just the one window after the guaranteed issue,
Uh,
right? So what
it's-
happens?
if there's like another weird one, like if you suddenly developed kidney disease,
Oh, sure.
you can actually get
Yeah.
that's just kind of a weird one too, where you can actually get it, which would be very useful, in fact.
That's because you reapply for Medicare under ESRD instead of being over 65. And so it counts as a second start date for Part B. That's correct.
I
It's
guess that's why
goofy stuff.
it's really weird. I was talking to somebody who had just started their Medicare at the Turnip Truck. So Lydia and Melissa, when we're there. So you may remember that conversation. I don't know if you heard all of that conversation. So that was something where I felt that the agent had been disingenuous at best and deceptive at worst, because basically they said, oh, you've got an entire year to sign up for your Medigap. So if you decide that you want to do your Medigap, and that's true, but they're using up their trial right.
Yeah.
So instead of going ahead and signing up for a supplement to begin with, during their guaranteed issue right, during that first 6 months, they're losing both their guaranteed issue right and their trial right, because they're going to be in their Medicare Advantage plan during the guaranteed issue right time, and then maybe changing their mind after that 6 months and before the end of the year, and then losing their trial right because they'll have used it up already. So it seemed, I wasn't fond of that. I mean, it's not something that I can report anybody for. It's not strictly speaking untrue, but it's kind of deceptive and it doesn't let them know that they're losing something. It wasn't made clear. Trial right. Also, because they never told the person that this was the trial right, then if the person actually did try to go and get a supplement during the year, but after the 6 months period, they might be turned down because they wouldn't know to say, I'm still in my trial right period. So, yeah, not fond of that.
Okay. Well, it's 11:30. Let's take a break until say 11:40. And when we pick back up at 11:40, we'll have a chance to answer any questions that y'all might have had. Then we'll pass out a printout of all the slides you've seen through the entire course of the training. And then y'all can log into Absorb and take the test. You're in Absorb, right?
I did not put them in, so we will
Oh,
have to
okay.
give you paper tests.
I will go and get paper tests,
That,
and we'll do these tests on paper. I guess.
I think
Well,
Yasha was out of the
yeah.
office, and
Okay.
so it
Yeah,
just,
she was ill last week and she may be ill again today because I saw that Lori was actually the one.
yeah, because I
Um,
emailed about
I
something else
actually
and didn't get a
paper
response.
tests, but
Why?
Okay. well, I'll go grab those.
I think the paper tests are actually a little bit easier for you because you have to, when you do it on Absorb, you have
Do
to
you
like
want me to print them?
make sure that
Yeah.
every answer is
But
registered.
I might say level 3 instead
I
of
think she
level
emailed us
2.
new copies, so I,
Yes,
hopefully
she
there's
did.
nothing wrong with them. Other than them changing.
Good.
And I would like to talk about the senior centers, an adoptive senior center. This is a fairly easy task to do, a fairly easy, fun volunteering thing to do. The only difficulty is that most of the ones that we have left are somewhat remote. I've got Hendersonville, Clarksville, Dover, Tennessee, Erin, Tennessee, Orlinda, and Springfield. But it's only once a month, so I would urge you to still consider seeing, I'm sorry about that, Rebecca, seeing if you want to commit to going out and visiting them once a month, and if so, let me know.
Well, I've got Gallatin. I guess I maybe could do Hendersonville too. Just hit them both on the same.
You already have one, don't take another one. Not until you've been doing it for a while.
Plus, I haven't even taken this test, which I probably gonna need more time on.
All the surveys.
Well,
Awesome.
I had so much fun doing them.
Yes, that's good.
Yeah, she has more and
Yeah, I love to know.
yeah, I love to go in and visit these, just. It's fun. All of them were able to like converse with me and,
Good.
yeah.
That's good, 'cause you never know, when you just get a name. And
That's
they're
right.
like, stay
Yeah.
there. So,
Yeah.
I think, thank you so much for doing it. How long did it take? Like, did it take an hour each?
Well, it depended on if they were talkers, which
Yeah.
most, about, I'd say probably 2 or 3 out of 5 were, but, so, I would say anywhere from 20 to 40 minutes, some of them. Like I say, because some of them have to chat and try to bring it back on track, but, yeah. Yeah, it was, anyway, I drive right by that Gallatin Health and Rehab, whatever it's called now, but,
I don't understand, but they constantly change the names of these places.
to make it sound like it's a better place than it is.
Like
Owners.
Called like the Opal of Music City or something, and then they changed it to Sapphire of Music City. And it's like, is that even really a difference? Like, just different colors? It's like, why?
Yeah.
Appreciate it.
Yeah. It's this Medicare stuff that's, I had my book, I read and even put tabs on some of my pages and I left it at home, so.
So what did you do in the garden?
Oh, you know what we did?
What did you do? You seem as if this was not entirely a mixed blessing.
What I did.
Oh, you took out did
No,
you
no,
poison it?
no. We laid plastic down on the ground around our raised flower beds,
Uh-huh.
I mean, garden beds.
Okay.
And we're gonna put some like mulch over the top of it because when we had those big rainstorms, it washed everything out and the weeds just, they come up. So
Yeah, I mean, that's,
I'm
It's
just,
not
I'm
the
just
worst.
having fun with you about the plastic.
yeah, no, it's not great. You should use soaked cardboard instead of plastic.
Yeah.
Use,
Well, I
Ye-
put cardboard down first, but I just didn't have enough of it
yeah.
to
I
cover.
put plastic down sometimes over, particularly if it's poison ivy, because I
Oh,
want to make sure that dies a
Yeah.
horrible death. And I have friends who are like on me about that because it's a native and it provides flowers and it provides berries for the birds. But
Yeah.
I'm sorry, I'm like, no. That's where I draw the line in my personal landscape because I'm so allergic. I
Yeah.
am not gonna, and I actually have a friend who's allergic and she's like, oh, well, I'm allergic, but I keep it there for the, I'm like, no. No, not,
Well, yeah, that was what my husband wanted to do. I mean, it looks, anyway, it just, they've just gotten really out of.
yeah.
We're just trying to.
I can understand that. I mean, I totally get that. I would just suggest that you see if there are any of the natives that you like and introduce them as part of your flower beds. And then you're able to support, do what you want to see in your landscape and have it looking the way you like it. But you're also then supporting the pollinators because some of those natives are very pretty. I mean, it's finding the right variety. Like there's um, uh, most columbines unfortunately aren't native, but there's a coral columbine that's native. You honeysuckles, we've got horrible invasive ones, but there is a native honeysuckle. So it's just being more aware of these things. It's a little trickier because you can't really rely on, you have to go to a good garden, a nursery that actually has some good stuff. And even then, you're not completely sure.
Well, I have a section where I had blackberries and they're, I don't know if the cold last
Yeah.
year, the last winter, like, but they all just,
I haven't had any
Dying.
luck with my berries, even though they've sort of come back this year. I just, yeah,
This year.
well, fingers crossed for you.
They're growing. I
Yeah,
think
well,
they like all this
mine,
water.
mine have grown. They just don't do anything.
I told my neighbors, because it's on the fence line, I said, in 5 years, we can have enough for our cereal.
That'll
Small.
be nice. It's so funny. My ex lives in River Plantation, which is all of these condos and everything. And some of them have really impressive strawberry beds. Because they only have a tiny little bit of ground that they can cultivate. And some of them have just gone like, okay, this is my strawberry bed.
Like this is your teeth for the first time.
I can't keep strawberries.
They have
Like the
flowers.
deer
They
just
do.
I don't care if I get the
eat
fruit.
all my
I'm like,
berries.
The flowers are very pretty.
Eat green.
Like some of them have pink flowers, which I
Mhm.
really like.
red.
I haven't seen purple for strawberries.
Well,
Purple.
they kind of, that's most of them flowers in my yard are purple, so maybe it's just in my head, but they are pink and red, definitely.
Yeah. Nice.
They're growing. They've got strawberries on them, but they're not really edible.
Okay, let's get back into it. Rebecca will be back in a moment. Let me make a note of when we're starting back up. It's 3:16. So, I realized we didn't go over a couple of things at the beginning that I ought to have. So let me get into this and double check some timing of things. So we can take the test today. And then some of you might have to do additional training, which is mentoring on either call shadowing or going out to events to reach your 18 hours requirement. So Lydia, I think you're good. You've done 2 events, call shadowing, everything. I think you're set after you've taken your test. Lisa, you've done mentoring. You did do those videos. How long did you do the St. Clair?
I was there from 7:30 until noon.
7:30 until noon.
That sounds.
Okay,
Yeah.
yeah, that's gonna count for sure. That's 4.5 hours. That'll put you well over 18
Yeah.
and you ought to be
But I'm gonna go back and work with her. She's gonna be there, I know, every month,
Oh,
at
Susan,
least.
that's great.
She's wonderful.
Yep.
Well, I'm so
Um,
glad.
That way I don't have to be on my.
So with Susan, she's really experienced, got a lot of knowledge about the Medicare program. She's not as experienced with STARS. Definitely come to Jordan and me for STARS help. Make sure that you're doing your STARS entries correctly.
And I had some kind of weird things. I checked in late that came up on my email, wanted me to check in at my event. And I thought, well, I've already been here for a long time, but I'll
Oh,
check in
sure.
anyway.
Well, you've said 4.5 hours, so we can go in, Rebecca and I, and change that to,
We'll change it to training probably.
Yeah.
Really, really nice event. I was impressed.
Oh, that's great.
St. Clair's a really fun center. Oh, did you meet June while you were there?
Did.
Okay, she's cool too. And then Melissa, you haven't seen the videos? Not yet.
I mean, initially, I told Rebecca, I didn't know if I could even finish this just because I had 2 weeks where I was out of town and then I had a big event.
Sure.
Yeah, so I still need to do, so.
Okay, do you think you could do that by the end of the month?
Yeah.
Okay.
I do.
And then I'm so sorry, I forgot to ask how long you two were on the phone together.
It was about 45 minutes or, yeah. I think I put it in the mentoring, and like with the little sheet where I do my faux signature.
I hit the
So
wrong,
it should be under volunteer.
the wrong keyboard.
And I need to do an event too, at least, I
Okay.
haven't done that, so. I'm behind for sure.
Yes, because that will put you, assuming that you do the videos, which you will, about 2 hours and 45 minutes left to shadow. So 1 event and then maybe a couple more calls. And that's, I think, a pretty attainable number. And then once you do your hours, then we can get you guys into STARS, especially people that want to counsel, which I assume is everyone here since it's the level 3 training.
Doesn't have to be though. I mean,
That's true.
yeah. If you want to step away from the counseling, that's fine. You can do events.
And then after STARS gets all set up, then we can meet either with me or Christine to go through the ship tracking and reporting system and all of its.
Very important.
Okay. So I think that's done then.
Do the videos count as training?
They do.
Part of it?
Mhm.
They
Okay,
do.
because, yeah, they were, not 30 minutes each, roughly.
Yeah, all together they're about an hour and a half. We count them as 1.58 hours. So whatever 0.08 of an hour is, it's good enough. All right. So now questions over anything at all that we've gone over days 1, 2, and 3. This is your last chance to ask clarifying questions before we set you loose on this test, which is again, open resource, multiple choice, multiple attempt, and you can ask your buddies for answers.
So most of the information that you are going to need is either from the very first day or from the volunteer and senior Medicare patrol, which I think is the second day. Is that correct?
We go over it first and second.
So most of the information today was the practical information. So when you're looking at that handout, take a look at the early days and see if there's anything that's still confusing to you. I noticed you know, we did have that conversation about TennCare and the Medicare Savings Program. So if you have any questions about who covers what, there are going to be a number of questions about who does what, you know, all these acronyms. Administration for Community Living, what do they do? Anybody know what their relationship to us is?
That's how the services are funded.
Yeah, so that's the funding source
Administrations. Yeah,
for SHIP SMP. Yeah,
well, it's important to know who pays your check, right?
it is important. So all of these different things, and then there's the Center for Medicare and Medicaid Services. Trying to think what other organizations they talk about in there. But any of those acronyms, if there are any acronyms that you're confused about, ask us about them, please. You ask about that. SMP, what does SMP stand for? SMP, what does that stand for? SMP, that's an important one.
Not to be confused with MSP.
It's not the Medicare Savings Program, SMP. There's a whole bunch in there. And you do need to understand about SMP questions because for some reason, I feel like they have too many SMP questions,
Yeah.
but they have quite a few SMP questions in there. So you need to know what it is.
It's the acronyms that I struggle with. I mean.
Okay, well, do you know what it does?
No, it's terrible because depending on what you're working in,
Yeah.
it's Senior Medicare Patrol. But,
Very good. I'm
but
wondering-
if you're talking to someone that doesn't do that, or if you have different roles, say it's financial or medical, then who the hell knows what you're talking about?
Yeah.
Because you don't.
Yeah.
Yeah, absolutely. So what does Senior Medicare Patrol do?
They fought
control
fraud.
Medicare.
They what?
Like
They-
fraud.
That's right. They're fighting fraud. So you might want to go ahead and review that part, or at least know where it is in your handout.